His ET index is 78 and he has 76,000 citations. His work has been published in very reputed journals like New England Journal of Medicine, Lancet, Nature and others. He is course director for annual courses in health research methods, randomized controlled trials, and he has delivered many invited lectures including in Oxford, McMaster, Harvard, Stanford, etc. He is also chairman of the ethics committee, 5 ethics committee and 9 project review committees. So we are very fortunate and we will welcome with a round applause, with loud applause today. And we will start the session because some of the dignitaries may take time to come, and I will request him to give the introduction to this course, and we can have a quick round if you want the introduction, otherwise we can start because that may take more time.
Yeah, we'll do that. So, and we really had a wonderful time. So it's great to be back in Jaipur, one of the most important cities in the world, right? So if people write 50 cities to visit in the world, I'm sure Jaipur will be somewhere on top there. So I bring you greetings from our medical college, that is St. John's Medical College and Research Institute, and we have a culture of research and service for about 40 years now, and of that I have been part of it for about 25 years. I was extremely fortunate to go to Canada in 2005, that is to McMaster University. What is McMaster University famous for? Maybe the university is not famous, but what they have produced or what they have contributed is very famous. Evidence-based medicine, everybody. Problem-based learning, we do that for our students. Right? Problem-based learning, evidence-based medicine comes from there. So I went and learned clinical epidemiology and biostatistics. I was associate professor of pharmacology and our department is quite good. But at that time, as associate professor, when I would see a number, let us say 0.87, and somebody is saying 13% reduction in mortality and death, I'm searching the slides. Where is 13%? I can't find 13% there. Okay. Then there is a line in the middle, there are lines across, there are dots here and there, and people are saying this is the forest plot, and they've used the random effects model to pool the data of what forest? I was lost in the forest. So this is as a faculty in 2005 from a good medical college. I'm sure all of you agree, right? But at that time, the principles and methods of clinical epidemiology was not so popular in our country. So I was really fortunate to learn all these things from there. And I recall my dean visiting me when I came there. And how many people say Niagara Lake? Niagara Falls. There is a Niagara Lake, by the way, right? After the falls, where it goes, it becomes the Niagara Lake. And just adjacent to that, did you go to Niagara on the lake? I'm sure if you, okay. So it's about 20 kilometers from Niagara Falls. Everybody goes to Niagara Falls. Like for example, everybody goes and sees the Taj Mahal and they miss the Agra Fort, which is one of the most beautiful forts. And we also, now see, I'm forgetting now. What's the city? Fatehpur Sikri, right? After about 7 visits to Taj Mahal, I finally went to Fatehpur Sikri. So like that, we miss Niagara on the lake. Anyway, so one of the prettiest little towns in the world that I've seen, and I've traveled to 48 countries. So I've seen many places. So I was walking with my dean there and telling, sir, I'm learning this, I'm learning that. When we come back, we have to, do courses and etc. I was telling, and then he said, sure. We can do that. So 2 years later, when I got back to my hometown and back to the institution, I was very lucky to get a grant from the National Institutes of Health, the NIH, and a part of that grant, it was a $4.5 million grant, it's about 26 crores at that time. 1/3 of that grant was to build capacity in the country for research. So we set up, so 2008, 2009, we set up research training programs. And since then, what little I know, I have been sharing with people, and we conduct courses, 3 types of annual courses we conduct. And like this, I've lost track of how many institutions I've gone and done workshops and courses like this. And So this makes me really happy when I get an opportunity to come and share that little bit of knowledge that I have. Madam was too generous, Dr. Rama. I can't. So she said one of the most. I don't know what you said, madam, but I was so stunned when you said that. Please, I know little bit, and that little bit I will share with you. And at the end of tomorrow's session, the takeaway. People always ask, "No, what's your takeaway?" The takeaway for all of us, including me, is there is so much more to learn. So we are just starting off. We are just starting off. But this start is important. Going back to Agra Fort, right? I'm sure all of you will be just like Amer Fort over here. All forts are like that, no? You have a narrow road, and then it turns, and then the main gate there is very narrow. You need to enter that door, and then the beautiful fort and palace and all the nice things are there, right? So it's very closely guarded, and the forts are designed to be like that. So today and tomorrow we'll try to open that first big difficult door, right? And then the learning can start from there. So this is my first quick, little orientation. Now, as I said earlier, this session has to be interactive, right? So this workshop will be enjoyable and productive. First, it has to be enjoyable and productive. Productive means you learn something, you get inspired, you want to do something. So enjoyable and productive, largely depending on you people. So you have to make it enjoyable and productive. Right? I'll do my best over here. I've done it in many places. I'll do my best. So you have to actively participate. That's my only request. So therefore, please open up your writing pad, and while you open your writing pad, close your electronics. That's exactly what I want. My closest friend. First, everybody's got a writing pad, everybody's got a pen, and does everybody's pen write? Somebody said, "Sir, I have a pen, but it's not writing." So do you have a pen that is writing? Okay, excellent. Okay, this is an anonymous question and answer. Okay, so don't write your name, your bank account details, and your PAN card and password and ex-girlfriends, boyfriends' names. No identifiers. Okay, right. So, question number 1. Listen very carefully. When you hear the word research, what comes to your mind? 3 words that come to your mind when you hear the word research. Write very quickly. 1, ABC. Quick, you must write. And write in English, write neatly. Write very neatly, actually. Not neatly, very neatly. 3 words. You shouldn't think too much. 3 words that come to your mind when you hear the word research. All right. Oh, you don't have a writing pad? Because you need to, okay. Did everybody write that? Okay. Question number 2. Leave some space. Write question number 2. 2A, B, C now, okay? 3 expectations from this workshop. 3 expectations you have from this workshop. So one is 3 words that come to your mind. Okay, no leaving blanks. So I'll go back to question number 1. Okay? Question number 1, 3 words that come to your mind when you hear the word research. Okay? So 1 ABC, right? Don't leave blanks. That means if only one word comes to your mind, B must be IDK. What is IDK? Okay. So write. Yes, I don't know. Write that I don't know. Don't leave blanks. If you leave blanks, then that is not okay. No blanks. Can we have more lights here?
Can you have the lights on?
Yeah. Put the lights on. No? Okay, so finish question 1. Question 2 is A, B and C again. Expectations. 3 expectations. Please write all 3. Write in English. Write very neatly. And I'll tell you why I'm asking you to write very neatly. All right. Now tear off that sheet. What happened? You didn't write anything. Oh, he's waiting for a pen. Can we have some pens for people who don't have pens? 3. Terrific. Anybody did not write still? You want a little more time? Okay, 30 seconds more. But tear it off and keep it ready.
I can't tear off my pen.
Madam, write in this, please. Write in this.
I need a pen.
Right. Yeah, give madam one pen, please, here. Okay. You know, in our life, when we learnt the most, don't say MBBS or B Pharm or, you know, when did we learn the most? Okay, let's go back to, okay, neuronal development. When did it take place? Maximum.
When we were in first.
Up to 5 years, right? 5, 6, up to that. Okay, so that is the time when we learnt the most. And why did we learn the most there? Because we learnt while playing, right? Unfortunately, now kids are, I think even first standard they're going for tuitions now, isn't it? Maybe they started NEET preparation in first standard itself this year. It's crazy what's happening. But anyway, let's go back to our days when life was not so bad, was different, let us say. Okay, we learnt the most when we had fun. Okay, we were standing up, we were moving, right? And we were talking, we were laughing, we were singing. What happened now? Life has become very serious. And what, 2 days research, biostatistics, oh my God. Okay, so as I told you a little earlier, this program has to be first enjoyable and then productive. And for that, who's responsible? You people are responsible. Okay, and is it okay to laugh in this room? Can we laugh? It's okay, no? So laughing aloud. And you know the spelling of aloud? A-L-O-U-D. When you laugh, laugh heartily. Okay, so that's what we're going to do. All right, so we're going to enjoy here. So at the end, tomorrow if you give me a feedback, you need to tell me how much you enjoyed this. What you learnt is byproduct, side effect. Okay, main effect is how much we enjoyed ourselves here, right? And we will be childlike when we do, right? And what happens in nursery when teacher asks a question? Miss, madam, I 8, 10 people will stand up and everybody wants to answer, right? So let us have that childlike enthusiasm to learn. Okay, friends, do we have a deal, right? How many people agree with me and are okay with the deal? Hands up. Hands up like this. Fully hands up. This is not okay. Yes. Good. I am happy. So as I told you, this program will be just as good as you make it to be. I have done this many times, and when I go back and when I talk to my wife in the evening, one of the questions she asked me, so how is the audience? How is the group? Because she knows if the group is good, I'll enjoy myself and the program will be even better. Okay. So everybody, we have a deal. We're going to enjoy this program and try to learn little bit here and there. Okay, we'll do that. Okay, so now I want all of you to stand up, please. Have you written? Where, madam? Three ABC. Where? My closest friend she is. She's not written ABC. Where? One ABC. Oh dear. Okay, so now what you got to do is you tone it off, right? You tone it off. Okay, so now move at least 3 people across in your own row and exchange it with somebody 3 places, at least 3. More the merrier. 5, 6, 7. So start moving. Come out, start moving. Yeah, you have to move. Exchange it with somebody. 3 and come back. Exchange it. Exchange. Hurry up. Move. Actually, come outside your chair. Okay, don't sit down. Okay. Now exchange it with somebody across. Right? Somebody across, behind or forward. Exchange, you exchange once more? Yeah. Excellent, now sit down. Ready? Okay, now, do you know whose sheet that is? Yes. How do you know? Unless you ask her whom she exchanged with, you don't know. That's not her sheet. Whose is this? You don't know, right? You don't know whose it is. So hopefully you can read what is there. Sir, tell us what is written for first question. So now, friends, what we are listening is what is in this room. So he can speak without any hesitation. Got it? If you exchange twice, 90% you can't figure out who it is. If you exchange it 3 times, 99% you can't make out who it is. Unless you've trying to backtrack, do an audit trail about it. Okay, and that's not the idea. The idea is now to find out what people in this room are saying. So question number 1 is, what comes to your mind immediately when you hear the word research? So tell us what 3 words are written on your sheet. Quickly.
3 research words that come to in my mind when increase innovation, learning and contribution.
Innovation, learning, contribution. Madam, what's on your sheet of paper?
Idea, innovation, useful for patient or public.
Innovation, useful for patient or public. What's on your sheet of paper? You can sit down if you don't want to stand. But
develop new thought, learn and make them learn.
Learn and make them learn, develop new thoughts, etc., etc. Okay, what's on your sheet of paper?
Research, paper writing, new study, data analysis, data interpretation.
Data interpretation. What's on your sheet of paper?
New invention, explored area and discovery.
Discovery. Okay, excuse me. Bhaiya. You want signature? No. They notice. Discovery, patient. Okay, somebody tell us the truth. Let's see if somebody's sheet has a truth. When you hear the word research, what comes to your mind?
What is written here is new things needs to be implemented, innovation, productive searches.
Oh, bonus. 5, 6, 7 is there. So many things. Somebody tell us the truth. Do you have the truth on your sheet of paper?
Innovation, solution, problem solving.
Okay. You know what the truth is? Did you write that? You wrote that. You didn't write that.
It's phobic.
That is the truth. The truth is phobia, fear. I don't want to do it. Let somebody else do it. You know what? If research papers was not a criterion for your promotion, will all of you be here today? Never. Never. Now people are telling the truth. This is being recorded, okay? Don't worry. Nobody is going to watch that recording. Okay? So dear friends, that is the truth. Forget about complex organisms like us. Multicellular organisms, right? Without even probably a brain and a nervous system, naturally moves away from pain and moves towards pleasure. Correct? Moves away from pain and moves towards pleasure. So what I am trying to achieve for you in the next couple of days is to make research enjoyable. If you enjoy something, you will do it over and over again. Nobody has to push you to do it. Correct? Right? So innovation, discovery, patient, this, that, all of that will come later. Once you start enjoying it and doing it naturally, right, you will want to do more and more and more of it. All right? Okay? So that's what we are trying to do. Let's now go to question number 2. Let's ask you, sir. Dr. Rajendra. Yeah. Question number 2 is expectations. Okay? Okay. One of you write down all the expectations. Who wants to volunteer to write down on another sheet of paper any new idea that comes? Okay. Rattle off very quickly. Sorry, before that, do you agree with me on the earlier point? We spent almost 10 minutes with that. And 10 minutes is very precious time. 10 minutes into, let's say, 50 people here on a Tuesday morning is very precious time, isn't it? Right? So we spent 500 minutes, man hours over here, man minutes over here, 500 man minutes to figure out that research should be enjoyable. And we're trying to find out how to make it enjoyable. Question number 2 is your expectations. Go ahead. What's written on your sheet of paper?
The expectation is to learn new things, new therapeutics, new ideas and progression in medical education.
Okay, medical education, new therapeutics. Are we going to do that in the next 2 days? So we need to have realistic. So it's good. Whoever wrote that, it's good that it's coming up. We need to be clear what we are trying to buy. Suppose you go to a clothes shop and tell him, hey, listen, I want an Audi Q6. Idhar nahi milega, sir. Go to the next shop. Okay, we're not going to learn therapeutics. We're not going to learn medical education. We're going to learn research. Okay, so what's on your sheet of paper? What's written on your sheet?
how to identify a problem important to the society.
Very good.
Second is how to find a collaboration.
How to find collaboration. So who's writing notes for us? Sorry, I wanted a volunteer to write down these new ideas.
Yeah, Anupama, can you do it? Yes.
Okay, on a new sheet of paper, separate sheet, okay? So one is how to find, it actually means how to find a research question, isn't it? How to find a research question. Second one is how to collaborate. Okay, now we're going to do rapid fire, very, very quickly. Okay, tell us, where's your sheet of paper?
Actually, nothing was.
You don't, okay, nothing, oh, you got a blank sheet.
No, I gave it to someone. I got a blank sheet in return.
Okay, all right. The system, okay. 3 expectations. Tell only one word, don't explain. Quick.
Methodology, statistics, protocol.
Very good. Research methodology, statistics, writing a protocol. What's written on your sheet of paper?
Concepts, clarity, basics.
1 second.
Concepts, clarity, basics.
Okay, basics, concepts, clarity. I like it like that. What's on your sheet of paper?
Why, how, and what.
Of what? Why, how, and what? That is, I don't know. Okay. What's on your sheet of paper?
So first thing, advanced research. Second, good research, and how to publish research in good journals.
Okay, publication. Right, publication. Madam, on your sheet?
Statistical analysis, clinical data analysis.
Okay, statistical analysis. On your sheet, question 2.
Information update.
Information update doesn't make sense to me. Oh, you already spoke, but we'll go to you.
Write able to write paper properly, and concepts, and
Publication.
And test.
Publication and statistics. Madam, you have a sheet of paper? You don't have. Sir? Publication.
Formulate the hypothesis, go for new innovations, learn at least 80%, learn new things, publication of paper.
Learn 80% of what? We don't know. Okay, so publication again. Anything new on your sheet? What we have not heard? Anything new? Anything new on your sheet? What's on your sheet? On your sheet, not your idea. Same thing. Anything new? Anybody's got anything new? Grant writing. Who said grant writing? Grant writing. Is that on your sheet? Oh, you want to learn? No, we will come to bonus. We'll come to bonus. So you'd like to learn about grants. Anything new? What? Anything new, Dr. Nisha?
To know about stats and to know better about these research.
No, so statistics, nothing new. So what do we have, Dr. Anupama?
Art of selecting research titles.
Yeah.
How to find the research question, how to collaborate, learning of data processing.
Okay, data analysis, right? Yeah. Okay. Now I have better leave the mic. Oh, Mike, I gave it to you. Okay, I have a question for you now. Everybody has tried research. Some of you have done good research. Some of you have done very good research, right? So all of us have done some research. Okay, what is the number one problem for you? So think about this, or maybe 3 problems when you have conducted research, your experience now. So we're going to ask you, we're not going to write on a sheet of paper, we're going to ask you, so but please write this on your sheet of paper. Write this on your sheet of paper, and I need 30 seconds to load my slides. So let me ask somebody who's not spoken so far. How about you, sir? What have been the challenges you have faced?
Sir, I write down three points.
Sure.
About the right way of research proposal.
Proposal, okay.
When to apply hypothesis.
Okay, hypothesis again, okay.
And how to validate a questionnaire.
Validate a questionnaire. So these are the problems you have faced, right? Okay, how about you?
Consent of patient.
Getting consent, okay.
Public demand, how it benefit me financially.
Benefit whom financially?
Patient, maybe public.
How does your research benefit the patient? What about, is there financial benefit for the researcher? Can researcher make money out of doing research?
Yes, definitely.
Possible. Okay. All right. So, good. How about you? 3 problems you have faced.
The data collection.
Data collection. Okay. Right. Okay. How about you? Yourself, yeah.
Types of study and sample size.
Okay. So, how to... Right. So study designs, sample size and analysis. Study designs, sample size, analysis. How about you?
Sir, consent form, how to validate a questionnaire.
Okay.
Or data collection.
Okay, and data collection. Anyone else with a new, something we have not discussed? How about yourself? Yeah, go ahead.
Lack of patient interest.
Lack of patient interest. So how do you get the patient interested in the research? Right? How do you get patient interested in the research? Yes.
Lack of awareness.
Lack of awareness among people about research. Yes.
Less cooperation with healthcare professionals.
No cooperation among collaborators. Correct?
Yeah.
Right. Okay. Yeah, that's important. Any other new thing? How about you, sir? What are the challenges you have faced?
Well, I think broadly speaking, I feel that designing the research to answer a question unequivocally.
Right.
I think that's
so answering a question unequivocally. That means without a doubt, very clearly. And to do that,
so probably funding is a challenge.
Funding is a challenge. Yes.
Or maybe data analysis is a challenge.
Data analysis is a challenge.
The way you analyze data actually can be biased.
Sorry, what? To say that again?
The way you analyze data.
Oh, yeah. Oh, absolutely. We'll shortly talk about biases, right? So coming back, one is how do you answer a question unequivocally, without a doubt, right? So a step preceding that, a step before that is how do you ask the right question, isn't it? Right? Okay. And then data analysis, and the way you analyze, there can be biases. What's one more thing you said?
Funding, operational
funding,
and data analysis.
Funding and analysis. Yes, madam.
The major problem that I face is data collection according to the protocol strictly.
Right.
And that is why handling missing data becomes a problem.
Excellent. So data collection, handling it before analysis, right, is a huge issue. I mean, if you take an analogy from common, let us say, our common life, okay, what you can cook in the kitchen is based on what? Is dependent on what you have. You want to make aloo gobi. There is no gobi, right? You cannot make aloo gobi, right? So he cannot answer his question unequivocally. So he makes aloo, but there's no gobi in it. You cannot call it aloo gobi. So he's not answered his question. Very good points, right? So I give analogies like this, which has nothing to do with, so the concepts are clear. Anyone else with unique challenges?
Identification of research gap.
Research gap, excellent. Okay, so in other words, identifying the research question, right? The research gap, very important. Yes? Someone else had a hand up here. Standardization. So particularly if you're doing lab-based research, standardization, excellent. Anyone else?
So often I get confused which statistical analysis do I need to proceed.
Right. So choosing the right statistical test. So for that we need to know all the statistical tests, right? And then you need to do that appropriately. So do you have to do a master's in statistics for that? Your background is medicine, pharmacy, what's it?
Microbiology.
Medical microbiology, right? So do you have to become a statistician for that, to know all the tests and which one to apply? Answer is no. Answer is no, right? I have learned statistics from so many different people, and in fact the best teachers for me are non-statisticians. Statisticians have a lot of knowledge, but only very few of them can process it and give you what you want, right? So you have, we were talking about infants today. You have a baby, right? You can't shove aloo paratha into the baby's mouth. You have to give, or 6 month old. 6 month we start, semi-solids and what. No, you cannot do that. Or maybe you have to do a paste of that and do whatever and put some curd, right? So you have to process it. And so to repeat myself, this is one of the biggest fears that people have. And another thing, now many of you are going to smile when I say this. Most of us took medicine because we did not like
mathematics.
I didn't say that. And now you're going to feel happy when I say the next thing. Statistics is not mathematics. Please write it down somewhere. And this is not what you're going to tear. Please write down, statistics is not mathematics. We need, as medical people, is to know the concept. You need to be aware. You can't say, I will do the paired t-test, or I will do Kruskal-Wallis, or maybe I'll do Pearson's correlation. No, you can't do that. Okay, again going back to aloo gobi. Okay, I can't say, okay, I don't have gobi. Maybe I'll put carrot in that, or I'll put peas in that. It becomes something else. It becomes aloo matar. It doesn't become aloo gobi, correct? Right? It's still, but it's still wrong. It is still wrong. You can argue back and say, oh, but you can still, if you don't have aloo gobi, you can eat aloo matar. No. He wants aloo gobi. That's it. He's going to stand up on the table and say, I want aloo. You got it? Right? So this is a major fear we have. We see all that formula and numbers, and statisticians, they love formula and numbers and equations. They'll put a square root inside the square root. Have you seen that? They love it. And for them, it is so easy to do that. And for us, Arey Baba, I left all this and I went and did medicine, and you're pulling me back into this. So we don't need to go back to that. Okay, in this, between today and tomorrow, I'll give you a flavor of biostatistics, right? And what you need to know. Okay, friends? All right. So let's see what quick feedback from you. In the time that we spent, are you beginning to think? Yes or no? Beginning to think. Okay, I'm not going to dump you with information. I'm going to make you to think. Are you beginning to somewhat enjoy the process? Okay, so by now, usually in workshops, you would have seen 74 slides. In 36 minutes, you would have seen 74 slides. Okay, bang, bang, bang. And then slowly people are doing this. What is this? You know what's happening. Okay, scroll up, scroll down, swipe right, swipe left. Okay, so that's what is happening in our life. Okay, so I want one more agreement from you, please. Okay, your mobile phones, please put it on vibration mode. If it is an emergency, if you are an emergency, not in the hospital, at home. Okay, somebody has to reach you, that is an emergency. Hospital, there are other people to deal with things. In fact, hospital is better off when we are not there, isn't it? Take that as a joke, don't take it seriously. Okay, so if you are expecting an urgent call, let's say your son, daughter has gone somewhere and has got a report, put it on vibration mode, right? So let's not have any disturbance, because we are going to go at a fairly brisk pace from here onwards. So I spent a fair amount of time to set the foundation for us to do what? Some people came late. Okay, so for them, what are we trying to do here today? We're trying to do two things. Came late. Did you hear this? Did you hear this? You didn't hear this. So we are trying to enjoy ourselves these 2 days, and if possible, learn. Are you disappointed? Oh, thank you for smiling, because you're looking very serious. Okay, and we also decided we are going to be childlike over here, and laughing is allowed. Spelling for allowed? If you want to laugh, laugh loudly. Okay, right? And we got to be childlike. We got to enjoy ourselves. And when a question is asked, I would really get energized if 20 people put up their hands, and I must have a problem on whom to choose. Got it? Right? If then, oh, come on, nobody knows this answer. Okay, and a perfectly valid answer is IDK. I don't know. Be happy to say that. Please don't say IDC. Don't say I don't care. Welcome to say I don't know. On a serious note, you know what happens in your brain when you say I don't know? In your mind, brain, whatever you want to call it. The brain starts telling you, hey, listen, I need to find this out. I need to find this out. And everything that I'm going to tell you is going to be useful and valuable for you. Okay? Right. So do we have our slides, Bhaiya? It took us. Sorry. Yeah, no, please tell. Yeah. I'll just wait for. As we approach the next 2 days, for you to participate, there are two options. One is the easy option. We said enjoyable, right? One is the easy option. The other one is the tough option. I'll tell you what the easy option is. Okay? Sit back. That means you're literally sitting back, looking at the slides, listening. And there are so many other people, they can answer questions, and you're still outside this room. Your body is here, but you are outside this room. That's the easy thing to do. You know why it's easy? Because we do it all the time. I am also guilty of that. Okay, we do it all the time. Nothing to feel bad about it. Okay, your writing pad is closed, your pen is closed, and your mind is closed. That is what? The easy part to do. Outcome of this easy part, you know the outcome. And tomorrow's feedback will be, this workshop was not so useful. There was too many technical things and not so useful for us. And that's not my slide. I'm not sure I can give this lecture, but 2 days you will be tired. You know when we are tired? When we do nothing, we are tired. You know when we are bored? When we do nothing, we are bored. Right? So your feedback tomorrow would be that this is boring, this was not productive, and of course not enjoyable. That's the easy thing to do. Are we here to do easy things? Okay, research is not easy. So if we choose the not so easy thing to do, you got to sit up. Book open, pen open, mind open. Including open to say, I don't know. Right? And feel free, feel happy to say, I don't know. When a new batch of postgraduate students join our department, right, I take 6 months to teach them to say, I don't know. It's not easy. They have done NEET exam, they did counseling, this, that, whatever. They have joined St. John's, and then how to say I don't know? They want to make an impression, so they give stories. They give stories here and there, right? So feel free to say I don't know, right? So book open, mind focused, right? And we're going to take breaks and tell me when the first break should be. We started at what time? About 9:45 we started? Yeah? So tell me, I can stop anytime. Okay, so Dr. Anupama, I'll look up to you to let me know when the break is. So let's decide. It's 10:30 now. 11:15? 11:15 for the first break. Okay? Right. Now, the slides that I'm going to show you, I hope they come up. I don't see it here. Okay? Too complicated. Okay? Right? I am not going to give you the slides. Are you sad? Not sad, right? Because I'm sure you collected thousands of slides and you have no clue where it is. You know what happens when I tell you this? You're going to write notes. Take photos of this if you want. Any key slide, particularly the outline slide. The second slide in all my presentations will have the outline. What is going to come? Take a picture of that. Take a picture of that. The reason I'm not going to give you the slides, there's nothing exotic in my slides that is not available in the world. I have not discovered anything. The only thing I have done is I have processed it for your consumption. Okay, and I've used the slide for different audiences and I've processed it for your consumption. Okay, ask questions at the end of a session. What is the meaning when a session is over? Okay, I'm happy to take questions, and nobody asks questions. What does it mean? Means two things. You didn't get your badge. Okay, doesn't matter. Okay, it means two things when there are no questions.
Either understood, either not understood.
Exactly. I've understood everything. I've understood nothing. I hope we don't have a situation like that. So ask questions, right? Answer. So when we are active like this, what is the outcome? Exactly the opposite. You will not be tired tomorrow because your mind has been active and you have enjoyed yourself and you have been productive as well. Right. Now, this is why I needed the board. Okay. Can you imagine a big IN that I have written on the board? Can you imagine? Our mind can imagine things that are not there, right? IN, first two letters of India, right? And also our, internet protocol code IN, right? In that, so you can imagine the big IN I have written here. On top there is information. What you will get out of this course? You will get information. Is that enough? Information is available. It's available in your pocket. You don't have to even open your computer or your iPad, right? It's there. What I want for you is much beyond information. The slides have information, and that's the least important. I want you to go one step beyond that and get what is known as insights. Can you imagine insight being written on the board there? What is insight and how is it different from information? Who knows? Your definition of insight, come on. I want to see hands up. Yes, madam, and then you. Insight means what?
Understanding and processing the information and coming out with an answer.
Excellent. It need not be an answer. You get an insight, right? So it makes sense to you. That's insight. Excellent. Insight.
Information is acquired from outside, and insight is how we perceive the information and how do we decide.
Exactly. Is that more important than information? Yes. Yeah, definitely more important than information. So we are attempting to get insights. Information is cheap, available. Those days we went Index Medicus. How many people have carried Index Medicus in your lives? Oh, only 3 dinosaurs here. Okay, so in a nice way, right? So many people have not seen Index Medicus. And then you go to the 17th aisle, madam. You go to the 17th aisle in your library, and then the 14th column, and then you look for that. You finally find that bound journal. You pull it out, page number 1844.
Missing.
You also happened to you also. So those were the days long ago. But today, you just pull it out of your pocket, right? You pull it out of your pocket. So information is cheap. It's available. Those days, people who knew a lot were smart. Today we call them mugpots. You don't have to remember so many things, right? But unfortunately, our exam system is still like that. So, from information, we have gone to insights. But I want you to go, what do you do with insights? Go home, put it in the locker, put it in the freezer in your fridge and lock it and keep. What do you do with insights? You need to involve yourself. Can you see IN again there? You need to involve yourself. In what? In doing meaningful research. Oh, this has come up. Fantastic. Okay, good. Okay, this is what, in a way, this is what we're going to be doing shortly, right? We're going to involve ourselves in research. No point in learning. There are lots of learned people around the world. There are very few people doing things. Next, you need to interact. Another IN. Interact with whom? With people within your institution and outside your institution and even outside your country. So I was really happy to hear from different people since yesterday about the Prime Minister of Czechoslovakia, Czech Republic, who was here, right? So one of the main things is research, right? They're planning research and innovation. Fantastic, right? It's really good. So we have, we have collaboration with about 30 countries from St. John's, and some of them are really major. So we're going to interact with people. And finally, the final 2 INs. Can you think of 2 more INs? Independent. You want to be independent? I just said involve, integrate. Okay, independent. It doesn't fit in there. Independent is a good word, but doesn't fit in there. Because we are telling the opposite, Dr. Shiva. Innovation. Right? Integrate, innovate, right? But I'm looking at 2 things. If I can manage just one thing for you in the next 2 days, I'll be a happy man. To inspire you. To do what? To get up from your chair and do something. Inspiration makes you uncomfortable. Even if you're sitting in such a nice chair, you're going to be uncomfortable. I want to get up and I want to change. What is going on right now is not good enough. I want to change things. And the final IN is very important. It circles all of this. Right? So we have information. What's next? Next? Involve. Interact. Innovate. Let's use innovate. And the final IN, my dear friends, which goes all around this. One final IN, sometimes we miss out on this. And I want you to keep that in mind throughout, please. That's when things go wrong. Can you come up with? Integrity. Right? To yourself and to the community for who we are doing research. Integrity for ourselves and for the community. Right, I almost finished the orientation. and anyway, it's great that, thank you for sorting out the technology. So I'm going to quickly give you an orientation and expectations from this. So it's always good to know where the faculty is coming from. So I'm going to give you a very quick introduction of what we do, right? So I started my faculty-based research in 1999. So it's going to be a quarter of a century since I started. So the first questions we asked is, what are the burden and risk factors for heart disease and strokes in India? I'm sure your Vice Chancellor knows about this project that we did. How can we better treat heart disease? So the first one is burden risk factors. Second one is, how do we better treat heart disease and strokes, right? So this is the research questions that I asked, right? And what are effective strategies to better treat a range of non-communicable diseases? That is what we are doing now, right? So these are our collaborations within St. John's. We collaborate with many major departments. These are our international academic collaborations. As I told you, this is McMaster University, and in the US, in the UK, in Europe, so on and so forth. I'll not spend time here. These are our national level collaborations. Nims is not here. What to do? We can do something about it, okay? And it's up to you. It's up to you. All right. So this is where we do our research. So we work with about 220 sites. So every time I put a dot on this map, I feel happy about it, right? And the areas of our work are observational studies, randomized controlled trials, and training. We do a fair bit of training. And this is a list of the projects that we have done. And those are the publications that you can see in brackets over there. Let me summarize this for you. The previous slide is summarized here. So there are 52 studies and about 1.2 lakh participants who have been followed up for 1 month to up to 7 years. And one of you spoke about missing data. When we don't have follow-up data, we get stuck, right? So here are our key publications from about 250 projects. 250 publications. So main Lancet is 20, Lancet family 19, NEJM 17, JAMA, so on and so forth. In 2008, I mentioned this to you briefly, we got recognized as a center of excellence, and this is for CVD prevention and capacity building in developing countries. We were one of 11 centers globally. It is a grant that I got for $4.5 million, about 26 crores. And knowledge translation studies, we worked in 3 major projects. 185 researchers from across India were involved, and 6 training programs in 5 years, and 200 people were trained in that. There was a 2-year faculty mentorship program that we did, and any of you are keen on a mentorship program like this, contact me later on. I'll not spend much time telling you here how we can enable, giving them funds, and how we can enable them to do research. Right, so just a couple of weeks ago, we were recognized as a Center for Advanced Research by the ICMR, and this is the project. This is how to conduct cost-effective and sustainable research and reduce cardiovascular disease. So our collaborating centers are the following from different parts of the country, and this is our applicant. So what are we doing? It's a 5-year project with a budget of about 15 crores, and I led a team of about 20 people from 7 different institutions, and it builds on 25 years of work that we have done and about 10 failed grant applications. Somebody asked about grant writing. First thing we need to learn is how to bounce back. You spend 6 months, 8 months writing a grant, and then you narrowly missed it. PT Usha, anybody remembers? So what is her story in the Olympics? So she came 4th. You know the difference between 4th and 3rd? 3rd one goes up on the podium and gets a medal home. 4th, 1/100th of a second. You take a second and break it into 100. 1/100th she missed it by. So sometimes you come so close to getting a grant, but anyway, 10 failed grant applications. So in this project, we're going to be, in this program, it's not a project really, we're going to be doing a series of projects. There's going to be systematic reviews, a cross-sectional study, a qualitative study, a 2-step Delphi process, a 18-center cluster randomized trial, cost effectiveness, implementation research outcomes, series of symposia with different stakeholders. No point in doing research and publishing it in Lancet and NEJM and keep, it doesn't reach the people. it doesn't reach the people. So, and we need to work through the government, with the government. And it's not easy. They have their own priorities. They can only think till the next election. And the next election will be few months away, few days away, right? And very, very difficult. But that is the way to work. Many researchers say, I can't go and deal with them, but that's the way to do. Okay, series of symposia, including with patients. How to involve patients. Patients are not interested in somebody else here. You need to do research that benefits them, not benefits you. If you go and tell a patient, see, listen, I want to collect data from you for the next 45 minutes. It is for my MD thesis. Patient will say, get lost. I'm doing, it's for my MD. Don't tell a lie. I'm doing this thesis, but this is what I'm trying to find out, which will help patients like you. If your MD thesis or MS thesis is not like that, you need to rethink. Why are you doing that research? We'll come to that. Okay, patient engagement, this is what I mentioned, policy dialogues with government, etc., etc. So, finally, what is our mission? To develop and conduct research for India and other low and middle income countries. Very important to keep research at realistic costs. Otherwise, it will just go through the roof. Right? Build capacity, that's what I've been doing now for 15, 16 years, and to transform knowledge. So these are the courses we conduct. So this is 2023 that we conducted this course. I'm losing this, okay. So this is the 14th annual course that we did last year. This is on randomized control trials, observational studies, systematic reviews, meta-analysis, qualitative studies for 1 full week, including publications, grant writing, ethics, regulatory issues, project, budgeting, health policy, data management, hands-on statistics, and all of this. Okay, this is a project, this is a course on randomized control trials alone, like factorial trials, non-inferiority, adaptive trials, expertise, step-based, implementation, community-based, real-world, pragmatic. Right? Again, statistics, techniques, operations, regulatory. This is a new course that we started, which is implementation science research. The ICMR is putting hundreds of crores in implementation research. And I sit on many committees, so this is really important. So that is very different from the usual research we do, models, frameworks, theories, concepts, how to operationalize, etc., etc. Right, who have been the participants? So in our course, we have had more than 2,000 so far. 24 courses or workshops have been completed since the last 14 years. People have come from 9 other countries. Our next course is coming up March 11th to 15th this year. Right, so with that, I just wanted to give you a flavor. Right, this is not an advertisement of the work that we do to the courses. So if you look at a person with whom you're going to spend 2 days, what is the background of this person? What are the motivation for this person? Is good for you to know. I try to find that out if people say, okay. So our objective is to become familiar and gain clarity. Somebody wanted, I want to be clear. That's what I'll promise you. If you listen carefully, you will get clarity. I'm going to keep things very, very simple. You may sometime, and some of you, if you know the concepts already, you may wonder, oh, this is too simple for me, but doesn't matter. So if you're listening it from me, I want you to go back and teach other people in a similar way, right? So when you leave a lecture, if you've understood something, is much better than you being fascinated by the lecturer's knowledge. That's great. That's why the person was invited to give a lecture, right? But you want clarity. And again, fundamentals, basics. Some of you are fairly senior people, right? You may know this already. You may have taught it, but again, let's redo that. But for those people who are just starting off in research, you could start off on research, anytime. Health research study designs, biostatistics, and research management, right? And in the next 2 days, we are going to do this, right? We're going to do a little bit of this, and we are not going to do this because there's no time for this, right? And hopefully we'll do this another time. Can you ask him for another mouse, preferably a wireless mouse? This is real. I'm not used to this. I'm used to my, Apple very smooth mouse. I'm a little spoiled. Sorry. Okay. I didn't mean to cut it out. See what happened there. Okay. So research management, we don't have time, but I'm going to tell you what is research management, and hopefully, Madam has said we can do a course a little later on. Okay. So this is what I want from you, to get motivated. I want you all to be motivated to learn more. So at the end of tomorrow, what should you go back with? There is more to learn, and I want to learn it. There is more to learn, and I want to learn it. Not, oh my God, this is so irritating and bugging and confusing. I didn't understand. Will you go back and learn more? right? I'm going to open that first door in Agra Fort or Amer Fort here. Okay, first door will be open. Rest of it you'll have to go. Which palace you want, which room you want, what you want to do, all of it's up to you. Okay, and look at the next word: conduct meaningful collaborative research. Every word on my slide is important, right? Learn more and conduct meaningful and collaborative research. Research that makes a difference is collaborative research, not sitting in one corner in one lab or collecting data from one person, collecting data from 84 people. That's not going to change the world. Okay, and I'm going to ask you what is the purpose of research shortly. Okay, so we did this already, right? Anonymous question we've done. Okay, here are our workshop topics. Let me expand this. So this is part 1 and part 2. So here is part 1. So what we're going to do in the next 2 days is research question and designs. How to ask a research question? You go to a cloth shop and ask them for vegetables, you will not get it. Or you go to a vegetable shop and ask to buy an Audi, you will not get it. It's not there. I don't think they sell vegetable in car shops or the other way around. Okay, so how to ask the right research question? Okay, just give a few seconds. We'll do that later. But what is aims? What is objectives? What is hypothesis? We get it all mixed up, right? Then we look at cross-sectional studies, registry studies, case control designs, cohort studies, randomized control trials, systematic reviews, and meta-analysis. Okay, and I'll give you examples for all this from the work that we have done and I have been involved. The reason I'm doing that again is not to show off and say, oh, we've done all those great studies. No, it's to say, hey, if this fellow can do it, he looks like us. If he gets a first authored paper in the Lancet, 1, 2, oh, good, I can do it. Right? You have papers in the NEJM, show me that, right? You want proof? And then say, oh, sitting in India, we can do this. So, the last line over there, you must feel uncomfortable in your chair. I want to get up and do this. If you can do it, I can do better. That's what you must say, all right? So, that is part 1. Okay, and we'll also do the basics of biostatistics. I'll give you a flavor, right? That means you come into the kitchen, you open the lid, you go back. You don't even get to taste it. You only get a flavor of biostatistics, right? We will do little more details later on, right? So this is part 2. We'll do this later on. So these are the statistical tests, the concepts of which occasionally I will show you some formulae just to show you what is in the numerator and denominator. I will not even tell you why are we multiplying it, why are we taking the square root. That is for statisticians and mathematicians. This is a formula, and why you need to know what is in the numerator and denominator. It makes a difference, and that much mathematics all of us know and we are comfortable with. Right? If it is in the denominator, it is inversely proportional. Right? It goes the other way around. If it is in the numerator, oh, it goes forward. That's all you need to know. Okay? Then we keep hearing of adjusted analysis. The first time I heard adjusted analysis, you know what I thought? So they're manipulating data. Have you heard adjusted analysis? Adjusted odds ratio, adjusted relative risks? No? Oh dear. Okay? So no. Feel happy to say no, because your mind is going to say, you better tell me what is adjusted now. It is not manipulated. The first time I heard it long ago, what is this? Actually, coffee break, I went and asked somebody, what is this? I didn't understand anything. Okay? They spoke about linear regression, multiple linear regression, logistic regression, multiple logistic regression, and then forward insertion of variables, confounding. Oh, right? I was totally confused. So, adjusted data, and it's very important. If today you are making decisions of writing a drug, it's based on adjusted analysis, and I'll tell you what that is. Okay? So look at the last part, which is relative and absolute risk reduction, and then survival analysis. Most of our major trials are done with long-term follow-up, and we do survival analysis. We look at hazard ratio, the 95% confidence interval, what all that means, right? We look at data collection instruments. DCIs means data collection instruments, or case report forms means the same. We look at databases. Start with simple Excel. I'll give you a little flavor of, you can even do fairly high level data validation and analysis in Excel on your phone. You don't need any fancy software. But how to get started? How not to do the wrong things? That's important, right? How not to do the wrong things. Okay. Then sample size estimation. This is a big problem. And in a way, the only reason we sometimes go to a statistician is sample size estimation. writing grants, regulatory and ethics, publications and presentations. You've done this wonderful research. How do you present it? How do you make slides? How do you stand at the podium? How do you use the mic? All of that we will have a rehearsal on. What is real world evidence? What is evidence-based medicine? All of this we will do another time. So what are we going to do in the next 2 days is this. This is what we're going to do in the next 2 days. Okay, so let's move on. And what method? So short interactive lectures. You will see slides like this. Large enough font. Can all of you see at the back, right? Okay, and I'd urge you to notice how the slides are made and how the slides are presented as well. Very, very rarely, you will not see 1.5 lines even on my slides. You will see them as large as possible, right? There will be only few words or a word and you need to explain. Okay, short interactive lectures. There will be priming questions. I'm going to ask you questions about the lecture that's going to come. Pre-test in your mind. Okay, we're not going to have pre-test and correct and do post-test. Pre-test in your mind. What do we do with all the knowledge? You're going to develop a proposal. By tomorrow? Yeah. By tomorrow you'll have a few key points of a proposal that you're going to develop, and this room, maybe we can have 2 or maybe even 3 groups in this room. Maybe one other room we will try and find out close by. So that otherwise what happens when people are talking, you get too distracted. We'll do that. That is for later in the afternoon. You're going to present and get feedback on your proposal, and then the full proposal can be presented a few weeks or months later when we have part 2. Okay. Okay, overall, ready for the last part? And you're beginning to have fun, right? Yeah, you're beginning to have fun. Yeah, I can see you having fun and I'm having fun. Okay, workshop outcomes, have fun. Okay, clarity, okay? Fundamentals in designs, biostatistics and research management, motivation, I'm telling you again and again, clarity and motivation to collaborate, learn more, right? And conduct meaningful research, right? So workshop guidelines for maximum benefit. Give a break to your electronics, except when you want to take a photo of the slides, okay? Give a break to your electronics, right? Put up your hands. When I ask a question, I want to see everybody's hand going up. When everybody's hand goes up, I'll be really happy, right? Interact very actively. IDK is a very valid answer, I already told you. And it's very welcome, no problem. We are not going to ask you what is the capital of Rajasthan. If you say Udaipur, it is technically wrong. You're close, but you're technically wrong. We're not going to ask you questions like that. Okay, friends? We're not going to ask you questions like that. So this is a great place to make mistakes. Do we have to have samosa inside right now? Place to make mistakes. Okay, final word as the samosa is coming. I am actually very grateful to you all. Grateful to Dr. Ramat, grateful to Dr. Anupama and Ankur as well. Anurag, right? Anurag and other people who helped facilitate this. So, what does a singer like the most? A really good singer like the most? To sing. Not in the bathroom alone, right? And it helps. It helps if there is an audience. What does a teacher like? To teach. And if the students or the learners or the participants, let's put it that way, we are all students, we are all learners, right? If all the participants are energetic, active, we really feel good. And honestly, I'm grateful for this opportunity to come and share the tiny bit that I know, right? So I'm looking forward to academically fruitful, or maybe I should invert it and say to have a socially enjoyable time. Right? So we need to chat, we need to get to know each other and to have fun. So dear friends, this is what I wanted to tell you. So in summary, fundamentals of study designs and little basics of biostatistics we're going to do today and tomorrow to get clarity and to be motivated. I want you tomorrow to feel uncomfortable. Uncomfortable means? Get up from the chair. I like him. Get up from the chair. And the last line over there is to be inspired. Inspired. All right. Open up your sheet of paper. Hopefully you are inspired now. 2 questions for you. Okay. Right. Fresh sheet of paper. Fresh sheet of paper because you're going to tear it off. Tear it off. Okay, so everybody's names are here in this. Okay, great. Okay, fresh sheet of paper. Question number 1. Your definition of research. What is, don't look at a dictionary or whatever. Your definition, or in other words, what is research according to you? What is research according to you? Your definition of research. Okay, write neatly because now you know what's happening. Oh, we're going to tear off your sheet. Are you okay? Okay. Oh, people are writing essays. This is a short question, not essay question. In one line you write, in one line, maximum 2 lines. Your definition of research. Okay, leave some space, go to the question number 2. Question number 2 is, what is the purpose of research? Why should you and everyone else be doing research according to you? What is the purpose of research? Why to do research, in other words? One line. Don't think too much. Don't write long answers. Okay, you know what to do next? You have to stand up now and go behind your chair. Stand up and go behind your chair. Oh, sorry, tear off your sheet of paper. Stand. Okay. Okay, start walking now. Walk 10 people across, not 3. 10 people across. Walk, 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 walk. Start. No shortcuts. Walk. Go behind your chair. First, follow the rules. Go behind your chair. Hey, no, listen. He's breaking all the rules. Along your line, 10 people you have to cross. Start walking. Start walking. Push the chair inside. Don't exchange samosas. Exchange only the sheet of paper. Half-eaten samosas, don't exchange. Okay, exchanged. Okay, now exchange with somebody behind you or in front of you, 2 rows, not 1, 2 rows behind you. Oh, madam has to do a lot of walking. Good to walk. देना, exchange करना है. Exchange मिल गया आपको? Exchange हो गया. Okay, now exchange with somebody behind you or in front of you. Oh, you went across there. Very good. Okay, sit down now. Okay, can you recognize anybody's handwriting? Do you know whose it is? No? Okay, sit down. Okay, all right. Dr. Mohit, where is Mohit Agarwal? Oh, Mohit Agarwal, not here. Yes. What is the definition of research on your sheet of paper? Not your definition, okay?
Identify a real life problem.
Very good.
And try to find the feasible solution to it.
Very good. Find a real life problem and a feasible solution. Excellent. Very good answer. Very good. Definition of. Oh, madam, Dr. Rama Chaudhary, your name is here.
To find out answer of unexplored problem.
Okay.
To find out solution for society's benefits to improve quality of human life and environment.
Wow, that became theory answer now. Okay, 5 out of 5. Okay, so very good answer. Let's get the next person, Dr. Bhumi Chaturvedi.
Definition of research is learning to know more.
Learning to know more. Fantastic. Learning to learn, right? Excellent. Good answer. Whoever wrote that. Very good. And Rajendra Devanda. Rajendra D. Devanda. Yes, please. To learn or study something new. Okay, last one. Mamta Yadav. Where's Mamta Yadav? Yes.
Is an idea that could change our perception about something that could be innovation, effective and efficient.
Okay, I can't repeat that now. Okay. Very, you know, when you can't understand something, you know what you say? Interesting. Very good. Excellent. No, it's my fault. I didn't listen carefully enough. That's all. Okay. Anybody has got something exciting on your sheet of paper? Hands up. Exciting on your something interesting other than what we heard so far. What's on your sheet of paper? Oh, both your hands are busy with samosas. Some people eating samosa with 2 hands. Very good. What's on your sheet of paper? Anything interesting? Nothing interesting. Okay, so who hasn't spoken so far? Whose voice we haven't heard so far?
Yeah.
Your voice we heard. Okay, doesn't matter. Tell like
The whosoever it is,
Ah.
purpose of research for
Not purpose, definition. First question.
so definition is like
Same thing. No, purpose will come to later. We are going in a systematic way. What's on your sheet of paper? Your sheet.
Research is the process through which we find solution.
Same thing. Sit down. Boring. Okay, anything new, exciting? All right. I will give you definition. My definition little later. But let us look at purpose of research. Why to do research, right? Dr. Anupama was very worried. Why do you want a bowl? No?
Yeah.
Now for this, is right in front of her. So I had to explain to her, convince her, please get a bowl, I need it. Manoj Kumar Mathur. Manoj? Yes. Purpose of research. Why to do research? What's on your sheet of paper?
Knowledge, helping, I like it.
Purpose. Oh yeah, fantastic. Whoever said that. I like the last line, which is I like it. That's what I heard. Other things are routine. Okay. Shobna Bhatia. Shobna. Oh yes, madam. Yeah. What's on your sheet?
Nothing, because I gave mine to someone and that person didn't return it.
Oh. So the protocol was exchange. That means you don't give till you get. Next time. Okay. Take, did not give. So that person's got 2 sheets now. Okay. Mohit Roy.
Yeah.
Mohit Roy. Yes, Mohit.
So it says, it's hard to read, but it says it's something we do to improve society, innovation, quantifying. So it says something, research is something we do to improve society, innovation, quantifying.
No, that is definition of research. Why to do research?
To fulfill the knowledge gap.
To fulfill knowledge gap. Okay. Tell us something new, interesting. Who's got anything interesting on your sheet of paper?
To solve the problems.
To solve problems. Right. Anything else? Okay. I mean, all nice, elegant answers. So let me now go to this. So, okay, before that, we've all got samosas and chai, whatever. It's, sorry? No, I'll have, no problem. It's 11. I'm looking all the time. I'm looking at you. So I'm looking at you. I want to connect with you. So therefore, even if there's a little distraction there, you notice me, no? I'll just stop. My brain, there'll be fresh sheet of paper. That means your mind is starting to think. Fresh sheet of paper. Okay. We can close this now.
Already close.
Okay, fresh sheet of paper. Now, surely some of you have done maybe even half a dozen research projects or 1 dozen research projects, many. But now, think of a new research question. Think of a new research question and write it in 1 full sentence. All this time I told you write 1 word, 2 words, 1 phrase, right? Write full sentence with proper grammar and full stop, not full stop, question mark in the end. That means your sentence should end, right? It can be 2, 3, 4, 5 lines, whatever, right? Write a fresh research question. It would be minimum 3 lines, okay? Maximum 6 lines, let us say. Full, proper English grammar also. I'm going to correct grammar also, okay? Go ahead now. You have 5 minutes. Think first before writing. Okay, or on the side you can scribble a little bit, generating. It takes 6 months to get a research question, by the way. I'm telling you to do that in 6 minutes. Okay, think a little bit and write a research question. Your research question, so you can't look at your neighbors. Okay, go ahead. All right. Okay, stop wherever you are. Doesn't matter if it's not complete. We'll move on to the next one. Next question is, what is the difference, in your opinion, don't be academic about it, in your opinion, difference between aims, objectives and hypothesis? Aims, objectives and hypothesis. Aims means this, objective means this, hypothesis means this. Okay. First one was writing a research question. I told you it takes 6 months to write the correct research question. You did it in 6 minutes. What we are trying to do is not get the right research question. We are trying to look at the components of a research question. All right. Okay. So let's ask. This is called Anupama's magic ball. Correct. Rajil Rajan. Rajil, yes. Read out your research question as you have written it. Full prop. That. Okay. So, drug A versus drug B in metastatic colorectal cancer. In cancer, drug A versus drug B in cancer. Simple? Okay, good, very good. Okay. So, next is Sumit Rajotia. Sumit Rajotia. Yes, Sumit.
Determine the neurocognitive function and brain volume in ECS patients.
Okay, to determine something in ECS patients. ECS is?
Exogenous Cushing syndrome.
Cushing syndrome. Okay. Right. So, to determine something in Cushing syndrome. All right. Akhilesh Patel. Yes.
Is paracetamol alters the blood pressure in hypertensive patients?
Does paracetamol alter blood pressure in hypertensive patients? Very good. Shivang Mishra.
Yes.
Yes, please.
Sir, ocular manifestation in post-surgical primary hyperthyroid patients.
Okay, ocular manifestation post-surgical thyroid patients. Very good. Okay. Saini, Dr. Saini? Yes. Sir, hold up your paper and speak up like that. We can't hear you. Ah, correct. Now speak loudly, little more.
Experimental study which assess the effectiveness and its knowledge, prevention measures regarding the pandemic disease of the COVID-19 state level.
Okay, experimental study to find out COVID prepared. COVID-19 to find out what?
Prevention methods.
Okay, knowledge of prevention methods. Okay, very good. Okay, last one from the bowl is Surekha Patil. Surekha Patil, yes. Please read out your research question. Sorry.
This question is a question that research project set on the question.
No, that is definite. No, what is your research question? What research you want to do? See, they want to do Cushing syndrome, thyroid and chemotherapy. What is it that you want to do? Not definition of research question. What research you want to do? You didn't write that. Okay, doesn't matter. No, there's a little misunderstanding. Okay, now let us hear. Oops. Is this working now? Ah, okay. Okay. Anybody wants to read out your research question? Oh, fantastic. This is what makes me happy. Okay, you first.
Comparative outcome analysis of lumbar radiculopathy patients treated with peripheral nerve block versus treated with caudal epidural injection.
Okay, so two types of local anesthesia or regional anesthesia, and what is the outcome you're looking at?
Outcome is pain relief.
Pain relief. Is that written in your question? Ah, okay. Right. Please sit down.
What is the role of ortho-K lenses to control myopia?
Okay. A particular kind of
Ortho-K lenses to control myopia.
Lenses.
Okay.
Ortho-K lenses.
Okay. A type of lens. What is the
Ortho-K lenses to control the myopia.
what is the role of to control myopia? Okay. All right. Fine. Anyone else? Yeah. Yourself. Yeah.
What is the prevalence of infections due to non-fermenters and their AST pattern at a tertiary care hospital?
Okay. The prevalence of non-fermenters in a tertiary care hospital. Okay. Good.
Whether aloe vera is effective in relieving symptoms in rheumatoid arthritis.
Okay. Whether aloe vera, is in relieving symptoms in rheumatoid arthritis. Yeah. This side. Yes. Hey, the boat should be balanced. We don't want the boat to tilt like this. Heavy weights this side. Okay. Come on. You have to fight. Okay. You okay.
embolization is effective in treating patients between age 18 to 60 years with grade 2 to 3 hemorrhoid and rectal bleeding.
Okay, so you have the age group, then you have the rectal artery, ligation? Embolization in type of hemorrhoids. Yes, yes.
Good morning, sir. Sir, my research topic is beside from the medical sector.
Sure.
I belong to the management field.
Yeah.
I want to research on the impact of social media marketing on the consumer buying decision and analysis of millennials and Gen Z consumers.
And what consumer?
An analysis of millennials and Gen Z consumers. Millennials consumer are those consumers those born between the 1981.
Oh, millennials.
Yes.
Millennials and Gen Z. Okay, I didn't hear that. Okay, millennials and Gen Z. Yeah, okay, good. Any other from this side? Coming. This side? You had a question? Oh, no, Maharaj, yeah, go ahead.
Exploratory study on nurses' job satisfaction and expectations from the authorities of selected hospitals.
Slowly. Expectation?
Exploratory study on nurses' job satisfaction.
Job satisfaction of nurses, okay.
Expectations.
Job satisfaction and expectations?
From authorities of selected hospitals.
From authorities of selected hospital. Fair enough. Anyone else this side? Okay, last two, 3 questions. Okay, good. Doesn't matter if we don't complete the syllabus. Are we here to complete syllabus? We are here to what? What are we here for? Fun. We are here to have fun. Okay, if you don't have fun, then complain to me tomorrow. Don't worry about completing syllabus. Sorry, where were we? Yes.
Effectiveness of aquatic therapy with Mackenzie spinal mobilization technique in the patients with mechanical low back pain.
Mechanical low back pain, and then what the first part?
It's aquatic therapy.
Aquatic therapy. Okay. And outcome is?
It's pain relief.
Pain relief.
Pain relief and improvement in the quality.
So is that outcome there in your question?
No.
Okay. Last two. One and you. Nice. Okay.
What is the safety and therapeutic efficacy of drug X on patients suffering from multi-drug resistant Staphylococcus aureus infection in bloodstream?
Okay. So drug X in Staphylococcus in the bloodstream. Last question. Yes, your research question.
What is the pattern of third molar impaction?
Pattern of?
What is the pattern of third molar impaction?
Third molar impaction.
And will linear measurement predict the mandibular third molar impaction?
Okay, mandibular third molar impaction. So impaction is your outcome, and who are your patients? Anybody? Children, adults, old, young, male, female, anybody? Right? Okay, good. So really nice research questions, and probably things you've been thinking of. Hopefully not the ones you've already done before. Okay, because we wanted you to think in advance. Okay, right. So next question is difference between aims, objectives, and hypothesis. Okay, Mundra. Yes.
Hypothesis is the research question.
Hypothesis is the research question. Loudly.
And the aims are basically they are the objectives which help us in answering the research question.
Aims are the objectives that help to answer the research question. And what is objectives?
Difference between aims and objectives.
Okay. No, fair enough. Okay. So difference between aims and objectives, you're not clear.
Yes, sir.
In 5 minutes, you're going to get that. Isn't that good? Yes. Okay. Good. Right. Rajesh Kumar Sharma.
Aim is to determine the problem with the research questions.
Okay. Aim is to determine the problem with research questions. Okay.
And object the outcome of the research.
Objective is outcome of the research. Okay.
Hypothesis is assume of the solution of the problem.
Hypothesis is how you assume the
Solution of the problem.
possible solution. Right. Okay. Anupama Sharma. Here we go. Okay.
Aims are target to be achieved.
Aim.
Objectives are tools and small goals to reach the target.
Okay.
And hypothesis is the basic concept and root cause to design a research protocol to decide on aims and the achievables.
This is a textbook definition.
No, it's mine.
Your own definition. I'm just joking. Okay. Concise form of something we want to achieve. Sorry, objectives are?
Expanded.
Expanded form.
Expanded form, okay.
Something which we want to achieve.
Okay.
And the hypothesis basically the statement of the relationship between two or more variables which need to be statistically tested.
That is textbook definition. Okay, good. Last one. Very good. Please sit down. And Sandeep Kumar, last one. Sandeep Kumar, yes. Sandeep Kumar.
Same. Sandeep Kumar Mundra.
So you are the other Sandeep Kumar. Go ahead. Oh, no Sandeep Kumar. Okay, we don't have Sandeep. Okay, this is Sandeep Kumar, unknown or not here. Okay, last one, Suman Chahar. Suman Chahar is also not here. And maybe Dr. Anupama later, no, maybe during lunchtime, make sure that everybody who's here, his name is here.
Sure.
So the idea is everybody should talk here. That's the technique here. Last one, Saurabh Devnath. Saurabh Devnath. Yes, Saurabh.
Sir, aim is mainly what is your motto to do any particular research?
What is your?
Main motto.
Okay, main motto to do research is aim. I like that. Okay.
What are the things we are going to find in particular research is the objective.
What you're going to find in the research is objective. Very good.
Hypothesis is the assumption. What comes in your mind to do a particular research?
Okay. Hypothesis is kind of some assumption. Okay. Very good. Excellent answers. Now, is everybody's both hands free? How to make both hands free? Both hands free. Okay. That means you have to drop whatever you are holding. For a good round of applause for all the answers that came just now. Nice and loud. Okay, good. Over the years, when I find somebody not clapping, I say, why you didn't clap? My pen was in the hand, sir. My mobile was in this, sir. That's why. So now I'm learning. I'm learning how to conduct workshops now. Okay, first have your hands free, and then we can applaud. All right. So first we looked at the definition and purpose of research. What is research? Why to do research? Right? And then the next one answer is how to do research. Finished. Okay, research question, aims, objectives, hypothesis. Madam, workshop over, we can go home. If we do this. Rest of it follows. Rest of it follows. And before that, what was a foundation? Right? Foundation, not information is available. That's the least important. Right? So we need to get insights. You must listen, process it inside. You must argue with yourself. You must answer questions. You must ask questions. Only then, batti, one light will come. That is called insight. It makes sense to you. Suppose the world's best lecturer on quantum physics came here and took off on a lecture. Okay, took off, assuming that you people are theoretical physicists, Stephen Hawking and Einstein and whoever else sitting around here, and talks like that. Wonderful lecture. World's best lecturer delivered a world's best lecture. What will happen to us? Any batti will come? No. We don't know. We are not in that league. Okay. So my job, dear friends, was this morning to bring you all up and figure out that we need to go beyond information. We need that insights. Then I want you all, see, already we did a little bit of collaboration, getting up, walking, exchanging. We are going to do more of that. We are going to do more of that. I've said it twice already. I'll tell it the third time. Meaningful research is collaborative research. Is working with people. Most difficult. Most difficult. I know many people from labs are here. You have equipment worth crores of rupees. And now these days it's all AI and ML and this and that. All that goes into the machine. It's easy. Because machines, you only need to plug it in and program them. They don't have moods. They don't have moods. They don't have headaches. Okay? They don't have children who are in the ICU. Yeah. Right? There is an example of a professor blasting this young lady for not completing the thesis target within that month. Blasted that lady. So she said, sorry sir, I will do my best. I could not work the last 2 weeks because my 10-month-old child has been in the ICU. True story. Did that this example I give when I take a session on mentorship for faculty. How to be a mentor. First ask them, how are you? Then ask what is happening with your thesis. How can this lady focus and recruit patients and get blood samples when the 10-month-old child is in the ICU for the last 2 weeks? Okay? So working with people is challenging. Machines calibrating, call an engineer, they'll fix it. So that is why India is just beginning to do good collaborative research. Beginning to do. 5 years back, 7 years back, I used to say we are not doing collaborative research. Okay, very few people were doing, and I was very fortunate since 1999, and I'll show you examples of this. I'm not just boasting here. I'm very lucky, that's all. I'm very lucky. I've been there at the right time, at the right place, with the right people, but worked very, very hard. Worked very, very hard. That's there. That's easy. Everybody can work hard, right? Okay. So we're going to figure this out now, right? So what is research, why to do research, and how to do research. I told you that is the crux of the rest of it will follow. So I'm going to take you through this exciting journey now, right? So first we're going to look at research question and components of the research question. Okay, no need to write notes. You look at your research question when I am giving this first part of the talk. Okay, and then you're going to rewrite your research question. Okay, friends, you're going to rewrite your research question. Next, I hope this one works. I think this one should work. Where to find research questions? Okay, like Isaac Newton, does it drop from the apple tree on top on his head? Did the apple actually drop? Do you know the answer? It's more a myth, it's not really true. Okay, where to find research questions. Okay, next, what is objectives, aims, objectives, and hypothesis? We'll look at all three, and very importantly, we'll go to research study designs. What can I get out of what? Okay, now I'm going to give you the definition of research before we get into all this. Okay, now there are many definitions of research, and all your definitions are right. I don't think anybody gave a wrong definition. I'll give you my definition. If you like it, fine. If you don't like it, even better. Even better, because you have a better answer. That's fine. So, and as always, since the morning I've been doing this. What is it? Simplifying things. So, RE, first two letters of research. So, we're going to use the same RE to find the answer. How about that? Okay. Research is asking a relevant question. Going to a car shop and asking for the car. Okay, not to a vegetable shop and breaking your head. Why am I not getting the answer to this? Why am I not getting the car? You are in a vegetable shop. You will get aloo, piyaz and carrots and cucumber. Okay, asking a relevant question. And doing what? And answering it reliably. What does reliable mean? You got the right sample. Your sampling was right. Your sampling strategy was right. Your sample size was right. Your study design was right. Your analysis was right. That means just before that, your hypothesis is right. We're going to come to hypothesis. That's all, friend. This is my definition of a research question. I hope you, even if you don't agree with it, I hope you like the simplicity and your ability to remember it. And please teach undergraduate students this. Teach them. Teach them this. Keep it simple. Keep it simple. Okay? Right. Why to do research? Why to do? All of you all gave very elegant answers. Shall I give you the realistic answers? Realistic answers to get promotion. To look good in the department. HOD, when he or she asks you, okay, what did you do last 6 months? What is the research output? Sir, accepted, sir. Paper. Madam, accepted. He's going to come. What journal? It's called the International Journal of Obscurity. Okay, impact factor 0.0043. It's like a nice p-value. Okay, jokes apart. Okay, no, it's a good reason to start. To get a publication for promotion is a good reason to start. Don't stop there. It's pathetic in India, the requirement for promotion. What is the NMC's requirement for assistant professor?
2 publications.
2 publications. It should be indexed.
Indexed and more than...
Indexed where?
PubMed.
Okay. Now let's not have NMC discussion here now. It should be indexed. Indexed where? In my atlas it's indexed. Anyway, so 2 papers as assistant professor, and associate professor I think 1 paper, and professor how much? I've lost track, I don't know. No. When you are associate in that period, whatever, anyway. Okay. So and you can be anywhere, isn't it? If there are 19 authors, you can be number 11, right in the middle. No, neither this side you can find nor that. Okay, friends. So as I told you, it's a good place to start your motivation to get a promotion. Why not? right, is a good. But don't stop there. The real purpose to do research is this. That's all. Because of my efforts, one patient is slightly better. Okay, some little knowledge we have, one patient. So don't miss out this humanity, right? I want to make a difference to people. So we start there. Okay, now let's go to parts of a research question. Okay, so like everything else, there are components, you have to break it down. Okay, we keep talking about the car. I don't know, today I'm stuck on a car. Usually I take some other example. Car is made up of so many hundreds of components, maybe even 1,000 components, right? So you break it down. So this came from McMaster University, right? And it is here. So this is the abbreviation for parts of a research question. Okay, I'm going to sit down now and we'll go about it step by step very quickly. Okay, it's very easy. P stands for population or patient or participant. That is the word to use. Don't use the word subject anymore. ICMR tells it now. You don't want to subject your patients to research. You want them to participate in research. Somebody here said, how can I make my patients more interested in the research? Make them a participant. Don't subject them to a research. Okay, so P is population, patient, participant, all P's. I is intervention. Now, in observational studies, there is no intervention. So the same IN we can use and say, what am I interested in? I'm interested in prevalence, I'm interested in risk factors, I'm interested in finding out causation, whatever, right? C is comparator. All worthwhile research has a comparator. There is something called descriptive research, right, which is not worth it. Okay, right? You need to compare my data compared to something else. What does it mean? Okay, so it's a comparator. And many of your research questions did not have O, which is outcome. Must be very clear, must be very measurable. And what is T? Excellent. So T is time bound, except for a cross-sectional study. Okay, cross-sectional study is not over a period of time, and even in a case control study there is no time. Okay, what are the types of or categories of questions? How much of a problem is there? What is causing the problem? How can I diagnose the problem? What can I do to change the problem? What happens to this problem over a period of time? Burden, cause, diagnosis, intervention, prognosis. These are all the categories of questions we can ask. All right. Where do questions come from? A patient is presenting unusually. Okay, I've never seen this before. It's not there in Harrison's. Okay, you asked everybody, they don't know. Okay, Kaposi sarcoma. Suddenly, where, right? Why are these people? It started in North America, right? Men who have sex with men, gay men. That's where we found Kaposi sarcoma. Then we had to find out. Then we went to Africa, and then we know what happened, right? So anything. So patients are a great source. So on rounds in the OPD, right? You get research questions, right? I love this. Other papers, when they conclude, right? They say limitations of our paper. When I go to conferences, this is what I make notes, right? Conferences are a great source of research questions. They have already done it. They are coming and presenting it. That means it's latest, taza khabar it is, right? But in spite of that, they have not done this. If they have done a good literature review, they'll tell you this is not yet been done. Our students can ask us. I love working with students. I spend a lot of time with undergraduate students, sometimes even more than with faculty. Okay, and I make them think. They come to me, sir, I want to join your research. I said, why do you want to join research? No, sir, you are doing good research, I want to join. No, to do my research work, I have enough funding. What do you want? If you want to learn research, come to me. If you want your paper for USMLE, honestly, very politely, I tell them, get lost. Go to somebody else. I don't want to waste my time giving you one authorship to go to the US or Canada or wherever. Other people will help you. That's not wrong, by the way. It's better than doing nothing. But it takes 2 months, 3 months for the UG students to find a research question and come back. Some of them give up and go away. I let them work with somebody else. Their motivations are short term. I want people to be inspired to do research. Okay. Right, okay, students are a great source. Most importantly, an inquisitive mind. Constantly keep thinking. Having a scientific temper. Temper is a short form for temperament. Temper does not mean angry all the time. Okay, temper is a short form for temperament. Having a scientific temperament. In other words, not being satisfied with status quo. That means if you like how things are, you won't do research. Okay, right. So would you like templates for research questions now? Templates for research questions. Templates for a cause. Okay, do patients or a population of participants who have a particular research factor, a risk factor, sorry, that's what I'm interested in, compared to those who don't have the risk factor, are more likely to develop an outcome, PICO. You can do this with a cross-sectional study, you can do this with a case control study. Similarly, template for diagnosis. Among patients with a particular condition, what is the diagnostic accuracy of a particular test, new test, compared to the gold standard, right, in detecting a particular outcome, right, sensitivity, specificity, likelihood ratios, whatever you want to have, right, and many of you are from a lab background and you will be doing these kind of tests, these kind of research. Template for therapy. Among patients with a particular condition, does drug A compared to standard therapy or drug B or placebo, right, reduce complications or death over this period of time, right? Maybe you should add over a period of time. Did you treat for 1 week or 1 month or 1 year? What is the duration of treatment? You need to add that. And template for prognosis is pretty straightforward, right? What happens to people with a particular condition and a particular biomarker, right? Do they have a particular complication or progression? All right, okay. So let me summarize this part. I like to start a research question as follows. Among, describe the P, population, patient, participant. Okay. So we know who you are talking about, right? One of our friends here who spoke about colorectal cancer came right at the end. Drug A versus drug B. My mind is racing. Is it for psoriasis or arthritis or alopecia or dementia? What? Where are you talking about? Okay, start, describe the or mention the participant or the patient. Okay, males, females, adults, younger people, older people, children, infants, who are they? Okay, describe that very clearly. Okay, and then go on to the other components. So it's nice, it's very clear, we know what you're talking about. Okay, friends. Okay, right, now go back to your research question and find out what. So first write the category. I'm not going to ask you. So write the category. You know the categories? You remember the categories? One of you read out the categories, please. Who's got that? Do you have the categories? Anybody wrote notes?
Burden.
Yeah, read out.
Burden, cost.
Write down in case you missed out, so you can mark it.
First one is burden, second one cost, third one diagnosis, fourth one intervention, and the last one prognosis.
Okay. So those are the categories, right? So first write down or say there's no category in my question. It's up in the air. That means you'll find out. So you write it there. So go back to your research question, examine it please, and then write your what category is it. Okay. Now write down what components are missing. You write down. You don't have to tell anybody. We're not going to read this out now. It's for your own learning. What components are missing and what are the components? Who knows the components? Can one of you read out please? Did you write down? Adam, did you write the components? PICOTS. Read out please. Yeah. Hold the mic. Yeah.
P stands for population, patients, participant. I stands for intervention. And in case of observational studies, we will say I stands for interested in. C stands for comparative or comparison. O outcome. T time bound.
Time.
Exception for cross-section or case control studies.
Wow. Why don't you give her a round of applause for such a comprehensive, nice round of applause. Okay. My friend, keep pen down. Please stand up and give us a demonstration of how loudly you can clap. Demo, come on. Not good enough. Come on, little more. You can do better. Little more. Yeah. Okay, last time, once more clap. And we join him, come on, yeah. Okay, sit down. So that is the award for not participation. We are friends, you angry with me?
No.
Okay. You know, just be childlike and participate, join everybody. Now I forgot where I was. Where was I? Oh, okay, no. Okay, you are looking at your research question now. I'm going to give you 2 minutes. Okay, and write down, do you have a category? If not, write the category, okay, and write the components. So redo your research question now, please. Okay, I'm going to close this. Let's move on now to aims, objectives and hypothesis. Okay, right. Now, if you're writing a grant to the NIH in the US, they have it slightly different. Okay, now this is for a broad understanding. Okay, when you write that, of course, by the time you write an NIH grant, you will have good, insights and information on how to write that. So anyway, so let me give you a simple, again, so far whatever we did it have simplicity and clarity? So far, right? That's what our goal is. And all of you all are with me. I'm happy with your participation, right? Okay, great. So aim defines what we want to achieve. One of you got it right somewhere here. Okay, so if I go back to my own life 25 years ago, I wanted to do something for cardiovascular disease. I was interested in that, and my PG thesis was on that. So when I started as faculty, I wanted to do something, and I was very lucky, and I'll give you examples of the work I've done. So I want to reduce cardiovascular burden, let us say. How do I do it is objectives. Objectives describes the steps to achieve that aim. First, I want to describe the burden, and I want to do this, and I want to do that, step by step. That is objective. Okay, there are 2 acronyms I'll give you, not my acronyms. I've got it from literature. I've heard other people say this. Okay, many of the other simplifying things are my little innovation, my little tweaking. But this I will not take credit for. Okay, objectives. There are 2 acronyms for it. Your objective should be SMART, and it should be fine or finer. Okay. Some of you may have heard this. SMART stands for specific, measurable, achievable and relevant. Is my objective SMART? Is a question you ask. Second, is my question fine? Is it feasible? Is it interesting? Is it novel? Is it ethical? Right? Is it relevant? So these are 2 acronyms, dear friends, you can keep in mind, keep in your book. And okay, now what is hypothesis now? Okay, hypothesis is testing it by an experiment. Now going and finding out the prevalence of a particular condition is also an experiment. It's a study, right? And you're going to make a conclusion. Is my prevalence similar, different, higher, lower than whatever else? Now we say, HIV we talk about, now HIV is coming down compared to what? Okay, so that is hypothesis. So one thing I want to tell you is write the hypothesis with a good statistician. I used an adjective here, good. Okay, there are brilliant mathematicians and theoretical statisticians. India is now producing good biostatisticians, but they are very rare. So if you find one good biostatistician, catch that person with both your hands, don't let that person go. Okay, because they are a rare breed. They are a rare breed. That means they can talk your language and you can understand that person's language, because they talk 2 different languages. Next time when I do biostatistics, I have a cartoon movie, or maybe I'll show you that cartoon movie later on. Okay, all right. So hypothesis. Okay, let's quickly now. Rest of it is going to be rapid fire. So listen very carefully. In other words, fasten your seat belts. Objectives. There's primary. It answers the main question. Okay, it is statistically powered. Yes. Yes.
Framing objectives, whether we have to add tool there or there is no need.
You can add the tool. You see, when we go back to specific measurable, measuring, I am measuring depression by what? Tool. As measured by. Correct, very good point, and I am happy for that question, right? So of course, I can give a 1-hour lecture on just this slide. Okay, so this is for you to go and learn more, and your point is very good, doctor, which is by what tool? Okay, I am measuring MI, by what definition? Right? Somebody is measuring quality of life. Oh, such a big difference. Quality of life post surgery is very different from quality of life in a village. or quality of life after let's say chemotherapy or something, right? Quality of life measured by what? Very good point. Thank you for that. Okay, objectives. Primary is the main question you want to answer, right? It is statistically powered. Okay, and please spend enough time on this. I usually give this example. I'll tell it very fast. Okay, somebody says from Bangalore, I am going to see Taj Mahal. I have 1 week for that. Fantastic, isn't it? So you go to Delhi, you land in Delhi, your friend picks you up, and friend is living in Delhi and says, oh, you come, I'm so happy, first time you're coming to Delhi. So one day they go to Bahai temple, another day to Qutub Minar and Juma Masjid, Aksharadhama, everywhere. And then suddenly you realize that tomorrow is my flight. And 1 week, and by the way, in case you people haven't been to the museums in Delhi, no, they're fantastic, yes. Right? There are some outstanding stuff. The Mohenjo-daro stuff is there, 2,000 year plus. I mean, I've gone to many other countries' museums, this is 80-year-old artifact, 80-year-old. We have 800-year-old artifacts here, just like that kept. Okay, anyway, going back. So where were we? Bangalore, you've gone to see what? Taj Mahal, right? And then you realize after 1 week, you are so damn busy, enjoyed yourself, eaten all the food and totally enjoyed yourself. Next year going back. Then the person goes back home, say, hey, how was your trip? Oh, fantastic, I did this, I did that, I did that. Hold on, you did all of that. Why did you go there? To see Taj Mahal. Taj Mahal I'll see later, but I did all of this. You did not achieve your primary objective. You had a great time, very fulfilling. Fantastic, but you did not achieve so state your primary objective and achieve that first. Finish Taj Mahal. You need at least 1 day. At least 1 day. You can spend more than that. Okay, at least 1 day in Taj Mahal. Then everything else is bonus. Those are all your secondary objectives. Okay, so your primary objective is statistically powered. Your secondary objective is also important. You've gone for 1 week. You saw Taj Mahal and came back, and another 5 days you sat in the hotel and watched Netflix. That is waste. Right? If you're in Delhi, also explore other things in Delhi. Okay? So you gain more knowledge. It is not statistically powered. It is exploratory and it generates additional hypothesis. Okay? Right? So friends, I also want to show you, this is a good way to make slides. No long sentences. 1 word, 2 words. Okay, and each line is animated. Please use this for your teaching and your presentations. Okay, I take whole sessions on how to make slides and present. Of course, medical education teaches all this, but people don't follow it. Even in my institution, people are cutting and pasting from PDFs, it's so, and they're professors, and they've also gone for medical education. Okay, so sorry, this is a little side break. This is how to make slides. Okay, hypothesis. What is hypothesis? Is a research question that is rewritten, okay, and this is analyzed statistically for significance. You either prove the hypothesis or disprove the null hypothesis. For the first time we are talking hypothesis, null hypothesis. This is where people start with, no? Right, and then our brain goes null after that, right? And then they give H naught and then greater than equal to this plus this. That's how we learn research, and that's why we lose it. And I've heard that so many times, and I decided in my courses I'm not going to teach people that. Okay, so that is hypothesis. Okay, right. Now from research question to hypothesis. Now research question guides the study design. Okay. Now many of you wanted to try drug A versus drug B, including aloe vera to chemotherapy versus this drug and that drug, right? If you want to do that, there is only one study design for that, and that is a randomized controlled trial. Don't do anything else. It's not worth it. Okay? Any other study design will give you spurious results. You will get results, right? Pharma companies still do cross-sectional studies and then say one drug is better than the other. Total waste. If anybody comes like that, chase them till the end of the world. Don't take money from those people to do those stupid research, right? We are doing a big disservice to humanity, starting with yourself. You're wasting your time doing studies like that. Okay, so study design, keep that in mind. Objectives guides the study methods. How am I going to do this? How am I going to do this? And what does the hypothesis guide you to do? Very simple, the statistical analysis. What is my hypothesis? Is this a superiority hypothesis? Is it a non-inferiority hypothesis? Is it a prevalence determination hypothesis? What am I trying to do? So accordingly, you do the statistical analysis. Okay, I want one of you to summarize this. Who wants to summarize what I told so far in your own words from your notes? I want to hear from you. Otherwise, I want to pick in the ball. I want to see hands up now. Come on, who is the first brave person? This is a challenge. This is a challenge. If I see more than 5 hands, I'll be a happy man. If I see 0 hands, I'm going home. If I see less than 5, I'm a sad person, but I'll still stay here. Okay, madam has got 2 hands. Okay, Anupama, for you. Yeah, go ahead. So take your, listen. Stand up, take your time and teach us what you've learned so far. Okay, yeah, take your time.
So the basic question is, what are aims and objectives? So aims.
Sorry, before that, research question.
Research questions.
You use your notes, take your book, use your notes, take 3 minutes, take 5 minutes. No, we are not in a hurry. Go ahead.
So when you're talking about research questions, the research questions based on few basic ideas. What are the components of the research question? The components of research questions are divided in basically 5 subcomponents, which are population, patients, intervention and interest of the researcher. C is comparators or comparatives, outcomes, and the study should be time bound. There are few exceptions. If you're not going for a time bound study, then the study should be case control or the comparative studies. The categories which we have to focus basically are the burdens, what we want to ask, what are the basic population we want to study, and what is the research burden, what are the causes, what we want to diagnose, what are the interventions we want to use in the study, and what is the basic research questions we want to put up. So the questions
I have
are
a
the
question
one.
in between. I couldn't ask you there. You said comparison and comparator may not be there in many studies because we are just doing an observational study or something. So
I'll answer that. Good question.
Take that.
So Dr. Rama is saying in some research there is no comparator. Okay. What I would like to put forth, dear friends, is there are studies like that. It is not worth it. Don't do studies that don't have a comparator. Give me an example of a study that does not have a comparator.
Prevalence of any infection in a hospital.
Okay. Then, okay. So how will you do the prevalence? You're going to collect data from multiple people who have the disease and don't have the disease. Those who have the disease, that's the prevalence. Correct? Right? Okay. Give me another. Okay. I'm going to do a.
You answer that question and say that people who do not have the disease are the comparator.
Becomes the comparator.
Absolutely. Yeah. Absolutely right.
Becomes a kind of control for them.
Right. Okay. So now there are about 60 people here. Okay. Vice Chancellor is going to call Dr. Anupama and say, give me a report of this. So Dr. Anupama says there were 60 people, and what else is she going to tell?
We had fun.
Oh, we had fun. Very good. So Vice Chancellor say, okay, very good. What else did you do?
You were not here to have fun.
You missed all the fun. Okay, we had fun. Okay, so now, next question in any sensible person's mind, and definitely a Vice Chancellor are all very intelligent people, extremely intelligent, and they are good with people. That's why they go to leadership positions. Immediately he or she will ask, okay, from which department?
Yes.
How many men, how many women? How many senior people, how many mid-level people, how many junior? What happened at the end of it? What is the outcome? So we see registrars, directors will also ask you for outcomes. So, right? So just telling 60 people, that is descriptive. There were 60 people, all of them are faculty at Nims. That is descriptive. Any use? We know that. We know that. So there are non-comparator studies or studies without any comparison. It's not worth it. I'm not saying it's wrong. After having done a course, I'm going to show you. I'm going to show you an example. Okay. Sorry. Go ahead. Madam, your answer.
I understood. Yes.
Now, what's the source of the question? On what basis the question have been derived? is either the patients or the papers, the conferences, students, and importantly an inquisitive minds.
Hey, not inquisition. You know what an inquisition is? It's very dangerous. Inquisitive.
Inquisitive.
Yeah.
And
who knows what an inquisition is? Yeah, go ahead. What's an inquisition?
Goa Inquisition.
Yeah. No, that is an example. Tell us what an inquisition is. We don't know what an inquisition is. That's a deadly example, but anyway, go ahead. All inquisitions are deadly, by the way. A lot of people die. What's an inquisition?
It's a legal.
Yeah, legal inquiry. Yeah. So yeah, don't mix up words. Okay. So we are learning thoda sa English also here, because sometimes we make this mistake. Oh, per year I read hundreds and hundreds of research proposals from different agencies. Some disasters are there in that, and written by mid-level, senior level people, otherwise nice, very good clinicians, whatever. But it's not just grammar issues like this or wrong words used, but also wrong things. Because I mean, to be fair, they have not done this in a systematic way. That's all. That's all. They are otherwise very good people. Yeah, please go ahead.
Yeah, so what about aim? Aim should be finer and it should be smarter.
Not aim. That is objective. Aim is overall what we want to achieve. Is there another mic here which we could use? Okay, it doesn't matter. It doesn't matter. Go ahead.
Mic, collar mic there. Yeah,
If it
that.
Covering overall question, overall research idea.
So I'll give another example of aim. I want to make diagnostic tests cheaper for people in laboratory, right? I want to make access to medications easier. Overall aim. How will you do that? Step by step we do. Okay? Yeah.
So the aim which cover the basic idea of the research, I believe it should be also smarter. And objectives, they should be fine, they should be to the point and smart enough. And the hypothesis
What is smart? What is the expansion for smart?
Smart.
Expand.
So specific, measurable, achievable, relevant, and there was one more.
Time bound.
And time bound.
T is time bound.
And hypothesis is what is the tool
So also tell about the final, just to revise that. The
Finer.
expansion of
Madam, let's listen from
that
madam.
is- No, just because they will remember.
Yeah, please.
So the final is flexible, it should be interesting.
Feasible.
Feasible? Oh, yes, sorry. Feasible, interesting, novel, ethical and relevant. Okay. And then comes to the hypothesis.
So
What is hypothesis?
hypothesis is tested by the experiments.
Very good.
Basic concept tested by the experiments, and it should be written with a good biostatistician.
Yeah. Write it with a biostatistician and
The primary,
Oh yeah. Go ahead. Primary and secondary objectives, please.
So the objectives have two basic parts: the primary objective and the secondary one. The primary is the main question which is to be answered. The secondary one is that is also important.
Primary statistically powered.
Statistically powered and the main question.
Yeah, that's your main question. Sorry?
Statistically, we wanted
What is the meaning of statistically powered? I'm coming to that. When I do sample size, I'll tell you about that. Okay? What is the power of your study? So that is when you're testing the hypothesis and when you have comparators. Otherwise, you look at precision, right? For your prevalence, right? Prevalence studies, or you want to determine incidence, you're going to look at precision. So when I do sample size, I'll tell you. Okay.
So the secondary objectives are also very important. They can help in achieving more knowledge, and they are not that powered as that of primary question. Statistically, the secondary objectives are exploratory and they help in generating the hypothesis.
Very good. Yeah.
Now, what is hypothesis? Hypothesis is the rewritten research question.
A research question rewritten. That will
It's okay. Yeah.
So, analyzed statistical significance, it can prove the hypothesis and it can disprove the null hypothesis.
Yes.
And objectives, that's also.
Yeah. So what about this last one that is there? You can just
Research methods and hypothesis guides to the statistical analysis. What is stats have to be analyzed, that is always defined with the hypothesis.
Okay, big round of applause for her. Good.
I have a question again. So in secondary objective you have written they are not powered. So how statistically they may not be powered. But they are going to be from the same sample size and from the same study population. So how do we say that they are not powered?
Right. So clearly the primary objectives and secondary objectives are different. They are not the same. Right. So when we estimate sample size, we look at that particular outcome, what we are interested in, and we ensure that they have the adequate numbers and duration of follow-up. That's also important for other studies to give us the outcome with whatever level of uncertainty you are ready to accept. What is that? That is our 5%. That is your 5%. That is where your p-value comes. See, first time we are talking about p-value. Okay, right? Type 1, type 2, errors, right? Alpha, beta, all that we'll do later, right? So, madam, for all you know, a secondary outcome may be overpowered, but you're not bothered about that.
Okay, understood.
You're not bothered about that. Leave it. It may be overpowered, underpowered. That is why the last line for secondary hypothesis objective is important, which is it generates hypothesis. One other thing, now that you are asking so many questions here, subgroup analysis. You will see there to disprove the null hypothesis. It is easier to say somebody is not here because I know that that person, like Vice Chancellor is not here because I know Vice Chancellor is somewhere else. It's easier to prove something is not there than to prove that somebody is. If somebody is here, then I have to go search everywhere. I have to dig here, I have to dig there. Understood? Right? It's easier to disprove the null hypothesis. So that's why they state it like that. Okay? There's a lot of theory behind that. Leave it. So for now, what this room has to take home, what this room has to take home is hypothesis is tested statistically, and my advice to you, strong advice to you, write it with a statistician. It has numbers in it, it has duration in it, right? And it is based on previous studies. Yes, your question. Sorry, when you're asking a question, questions are welcome, by the way. Quickly shout out your name and your department. No. Simple answer is no. And you know what? My advice to you, don't worry too much about it. Okay? So take home the previous one. This is where, we go and dig in unnecessary places, which is not relevant for us. And unfortunately, we've been taught this. So don't worry about that, Dr. Akanksha. What you need to worry about is what is hypothesis and how to write it. Don't go beyond that. Okay? When I come to sample size, I'll tell you how to deal with all these things. Shall we move on now? Okay? Yes.
Do we need to state hypothesis if it is a pure descriptive study?
Yes. Oh, descriptive study. I just told you don't do descriptive studies.
So
sit down. Don't do descriptive studies. You want to do comparative study? And now stand up. Ask your question.
No, but I think he answered that in all our descriptive studies there is a comparator. We are actually not.
So
hypothesis.
Then it becomes a problem. No, the thing is that
I'll answer this quickly. Okay. People confuse observational studies from descriptive studies. Write this down in capitals. All observation studies are not descriptive studies. All observation studies are not descriptive studies. Next line, write down. Sorry, I'm being a school teacher now. Okay, descriptive studies are not worthwhile. Write it down. Don't waste your time on that. And don't ask another question on descriptive studies now because I'm going to get very angry with you. You've not seen me angry, okay? We've only been having fun. And no more questions on hypothesis. Because you asked me that question, I love it so much, I'll go on and on non-stop. No lunch for you all then. Okay? Okay, friends, so let's move on. So, Dr. Shiva, what did you write? Two to loudly tell us from there.
All observational studies are not descriptive studies, and descriptive studies are not.
Descriptive studies means there is no comparison. At the end of it, there is no p-value, there is no confidence interval. Okay, now, very important. At the end of your research, very important, listen to this very carefully. Who are all the people listening to me now? Hands up. Somebody has 2 hands up, very good. Okay, you know why? This is just to do some activity as well. Okay, so hands up, hands down. Later on, we're going to do other things as well. Okay, so at the end of your research, you must ask the question first before telling anybody else. Ask 2 words. I'll write it here. Where's the pen gone? I put it somewhere. It's here. What is the question you're going to ask? 2 simple words. Okay, I'll put it here. What is the circle for? Before I rub it off? Yeah, right throughout. I'll not break the integrity. I will keep it here. Okay, right, integrity is there. At the end of your research, you must ask the question of yourself. Hopefully you ask this question right at the start, so you get the answer to the question. Very good. Okay, इसका integrity थोड़ा गड़बड़ है अभी. Make a difference to humanity. So you found this, so what? You did a prevalence study, so what? Okay, if you don't have a comparison, one other very important thing. See, this is what I want you to learn. This is what I want you to learn. Okay, right? A number by itself means nothing. Number by itself means nothing. It has to be compared with something else, or it must have a qualification. The number should be qualified. 68, does it mean anything to you people? It means a lot to me. It's my year of birth. It means a lot to me. Okay, so a number by itself has no sense unless you qualify it or you compare it. That is why I repeatedly said descriptive. So descriptive studies are not just observation. I mean, they are observational studies. All observational studies are not descriptive. Worthwhile studies are comparative studies. Okay, so at the end of it, we must ask the question, so what? Okay, so now let's quickly go through this. Research study designs. You got to listen to this very carefully, because in the afternoon, you're going to sit down in groups and do work based on this, what I'm going to tell you. Okay, research study design, broadly quantitative. They have numbers, they have measures, they have statistical inference. There are p-values, there are 95% confidence interval, and you tell whether this is important or not important. All right, it answers the question, so what? What is the other type of research design? Qualitative. Somebody tell us your definition of qualitative. Nurses, we have nurses here, they do very good qualitative research. Doctors are just beginning to do qualitative research. What is qualitative research? There are no numbers. Okay, no numbers. We want to understand a particular phenomenon or phenomena little more deeply. Okay, and that makes a difference. So, I keep forgetting to add this next line, but it always comes to my mind. So, another type of research is called mixed methods research. So, write this down because it's not on my slide. Mixed methods research, which is a combination of qualitative and quantitative. Qualitative and quantitative is called mixed methods research. Unfortunately, I read lots of proposals written in our country with mixed up designs. Mixed up and messed up designs, and and some big grants we ask people to present, and when we ask them, what is the design, they are lost. They are lost. Okay, now I'm going to frighten you a little bit by showing you a very complex table, a very complex chart. You cannot read it. I will warn you in advance, so sit back and watch it. Okay, medical research is called primary research and secondary research. Primary means you are collecting data fresh, Secondary means data already there, you can do research on that. That is still research. Okay. In primary research, we have basic, clinical and epidemiological research. And in basic research, you have so many: theoretical, applied, cell studies, gene studies, biochemical studies, genetic studies, analytical imaging, blah, 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 bioinformatics, whole lot of basic research. Then we do clinical research, which is experimental and observation. Don't write this, Madam, don't bother. Don't bother writing this. I'll give you the reference for the references at the bottom. I will tell you what to write down next. Okay. So listen very carefully. Okay. Experimental, you know about this clinical trials, phase 1, 2, 3. Then we have observational, which is also clinical research, therapy, prognostic, diagnostic, case series, all of that. Let's go to epidemiological research: intervention study, field study, group study. Then observational, cohort, historical, case control, monitoring, surveillance, descriptive registry, blah, 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 blah. These are all the types of primary research. I deliberately ran through this quickly. Next, we have meta-analysis and systematic reviews. Systematic reviews and meta-analysis. We'll talk about that later. I am tired talking about this. Let us do this. This is what I like. So, let us now look at the fundamental concepts of the most important and relevant study designs. And you're going to work on this in the afternoon. All right? Okay. First question we ask is the investigator assigned any exposure? That means, was anything different done? Yes or no? Answer is yes or no. If it is no, it is called an observational study. I am just observing what is happening. And there are many designs even in observational. I am just observing, but I am doing something, means experimental study. Okay? Experimental and observational study. At the end of it, write down. Now listen carefully, everybody. Now let's look at the experimental study side now. In the experimental study, there is more than one group, at least two groups. At least two groups in the experimental. You are always comparing. Where these groups randomly allotted. If it is randomly allotted, it's called a, we all know this, randomized controlled trial. The C in RCT is controlled. Clinical is not fully correct, because I can do a randomized controlled trial in hospital, not only hospitals, in villages, in schools, in districts, in supermarkets, nursery schools, whatever. So the C in RCT is controlled. Clarified? Many people. Okay, right. Randomized clinical trial is also correct. It's not always correct. Okay, if there's no random allocation, it's called a non-randomized controlled trial, or it's called a quasi-experimental study. If you're writing notes, QUASI, quasi-experimental study. Okay, another name for it is before-after studies. Okay, they're all study designs. They're all experimental studies. Okay, the gold standard is randomized controlled trials. Okay, friends. Okay, now let's go to the other side, that is the observational study. Everybody can see this from the back? Okay, maybe we can get this light off without the reflection, no? Only this row. So if you put off more lights, I will go off to sleep and you can't make out if I'm sleeping. Okay, so where are we? Observational studies. Is there a comparator group? What did we say so long about without a comparator group? It's a descriptive study. No comparator group. Don't even do that. Okay, not worth it. Now, if there is a comparator group, it's called an analytical observational study. What is it? Analytical observational study. This diagram, by the way, is from Lancet 1991. Some of you may not be born that time. Such an old classic paper. Simple. If do you recall the title of my previous slide? Title of the previous slide, my slide I just showed you? Let's simplify. This is as simple as you can get it. Okay? It's an analytical study when there's a comparison group. The direction the study takes, based on that, there are three types. Okay? First, let's look here. It's a cross section. You can see my arrow there? Oh, you can't see the arrow. Oh dear. Okay, wait, let me see if I can use a laser pointer. Okay, here. Okay, now you can see. Okay, it's a cross-sectional study. This is at one time. Exposure and outcome is collected at the same time. case control study, outcome has taken place, you are going backwards to collect exposure. We're going to see examples of all this now. And then you have the cohort study, which is going forward. Exposures you keep on measuring and wait for outcomes. It's a 6-month cohort study, 1 year. If you say cohort and you don't say the duration, done. Okay, same thing with randomized control trial. Also, you should say the duration of exposure and outcome. Okay, once again, cross-sectional one time, case control, you measure, the outcome has already occurred, you're going backwards to study exposure in cases and controls. Cohort, there are people with and without exposure, you're looking at outcomes. Okay, friends? Okay, as simple as we can make it. Okay, now, what are the uses of different study design? You want to look at prevalence, you do only a cross-sectional study, more than enough. How much of disease is there at one point in time? And you compare it with another. So, in rural areas, coronary artery disease is increasing compared to what? To urban areas or compared to other rural areas in the past. Or in Bihar, this one is so much compared to another state. Okay, right, prevalence, cross-sectional study. Incidence means how many new cases in a defined period. Only a cohort will tell you. You cannot get incidence in a cross-sectional study. It's like asking for an Audi in vegetable shop. You will not get it. Okay, all right, right. Cause of a particular condition. Cross-sectional study, case control study, cohort. All three you can do. But in terms of reliability, which is best? Cohort is the best. All right. Prognosis. What happens over a period of time? Only cohort will tell you. Okay. Natural history of disease, similar to cohort, prognosis, is a cohort. Finally, treatment effect. How does this treatment compare to another treatment? Only a randomized controlled trial, nothing else. Don't attempt anything else. Okay. So these are the uses of different study design. Okay, friends, let's summarize. Research question has 5 to 6 components. There are different research study designs. It is very clear and well defined. There is mixed methods. After the session, you should not mix up your methods, mix up your designs, right? As clear as this. Okay, a research question can be answered by different study designs. Okay, some are superior to the other for specific questions, right? I just told you about what did we look at previously? Remember the table? Cause of a particular condition. Case control, sorry, you can even do a cross-sectional study for cause, right? But it's not good enough, right? You can also do a case control, that's also not good enough. Only a cohort will tell you. And remind me when I do the lecture on cohort studies, if I don't answer this question, remind me. Okay, we'll address it once again. Some are superior to the others. So we are very clear now. Okay, now what are the, let me blank this off. Okay, you know how to blank the slide? Blank, gone, gayab. Press the letter B, B as in Bangalore. It just blanks off. What happens when you blank the slide? There is nothing for you to see. You have to listen. Okay, so use this technique as well. In class I use it all the time. Blank it off, ask questions, there's nothing else to see for them. All right, okay. So now commonest research designs for clinical research. Right, there are diagnostic research, there are other types. Okay, broadly qualitative and quantitative. Okay, in quantitative, observational and interventional or experimental. Experimental, randomized, non-randomized. Wherever possible, don't do a non-randomized study. It's a waste of time. Do a randomized control trial. Okay, there are very rare occasions where you cannot do a randomized trial. We'll talk about that later. Observational studies, cross-sectional, one time. You go and ask questions at one time, thank you, goodbye, results later. Case control, outcome has already occurred. The case is there in front of you. You collect exposure in the case. And you compare it with who? With a similar control. I'm going to do a whole lecture on that. Case control design. Then finally, cohort. Definition of cohort, English meaning of the word cohort is a group of people with similar characteristics. Cohort actually comes from the Roman days, those Roman days of war. Cohort of this, cohort of that, they sent out. Anyways, army, exactly, okay. So that's a cohort. And then you follow them up. Some people will have exposures, you measure the exposure, you look for outcomes. Other people have no exposure, they may still have outcomes. If that exposure is associated, right, we'll come to all of that. Association, causation, these are all confusing things. I will not do hardcore community medicine and epidemiology here, but clinically, or for us to use, what is it used for? Okay, all right. So, are we clear now? Okay, study designs are very clear. And close the chair, push the chair, stand up, push the chair in front, make it straight. Very good. Stand up. Okay, you need to now go and give a high five to 5 different people and come back and sit down. Go ahead. So let me all do 1, 2, 3. We also 4. I can't sit otherwise. 5. Okay, 5 different people, and come back to your seat. You can sit down. Questions for you. Rapid fire questions. Fresh sheet of paper. Answer quickly. You must answer. Only for yourself. We are not sharing it. We are not discussing it. Okay. This is to create, if necessary, space in your mind, in your brains. Okay. Question number 1. What is the purpose of a cross-sectional study? Purpose. So you write 1. Purpose equals write few words. Couple of words. Don't write more than 1 line. Purpose dash write something. Next, question number 2. What is the difference between sample and sampling? You can write IDK quickly, if applicable. Difference between sample and sampling. When you say sample, it is not blood sample, it is sampling people. Okay. Okay. Difference between sample and sampling. Question number 3, your definition of bias. Your definition, don't go textbook. Your definition of bias. Question number 4, I am deliberately not giving a lot of time. How many biases are there? You either write a number or write IDK. How many biases are there? Don't write more than 1 because the answer is correct. If you write more than 1, answer is correct, no? Don't outsmart the system, but write how many biases are there. Okay, next question, 5th one. What is a cross-sectional study not suitable for? What is it not suitable for? In other words, you should not do a cross-sectional study to answer this question. So, question number 5, not suitable equals, you write whatever. Your answer. Okay, part B, that is question number 6. What is a patient registry? What is a patient registry? PTREG equals, you write your definition. Next question. What study designs are used in a patient registry? We are now experts in study designs. What study designs are used in patient registry? Okay. Last question. Last question is an example of a registry. Do you know an example of a registry? Either you did it, you did a journal club, you read somewhere, you heard somewhere. Example of EG, REG equals, you can write whatever. Example of a registry. Do you know a registry? Did you do a journal club sometime? Okay. Did you hear about it? Did somebody present? Or were you part of a registry? Write one example. Okay. So, shall we move on? Okay. So, what we are going to do is the following. Answers to all those questions are coming in the next 15 odd minutes. So, fasten your seat belts. This is a relaunched Concorde. You know about the Concorde, right? Who knows about the Concorde? Yes, tell us.
Concorde was
Excellent.
And it was mostly transatlantic, I guess.
Only transatlantic, yeah. So it went from Paris to New York or London to New York. So traveled at the speed of sound. So 3 hours to cross the Atlantic. Okay, excellent. So if you're going on a Concorde, you better have your seatbelt fastened. So all along we went in a relaxed flight, but now, okay, cross-sectional studies and registries. Okay, we're going to look at the purpose, the design of a cross-sectional study, what is sampling, what are biases, how to analyze a cross-sectional study, and I'll give you some examples of a cross-sectional study. Okay, what are registries, why we do registries, what are the purpose, definition, how to analyze a registry, and I'll give you some examples of registries. Okay, that's what we're going to do in the next 20 minutes. So we can take this lecture for 2 hours, but let me give you the most important things along with examples. Okay, and if anything is not clear, so don't stop me now. If you stop me now, then lunch will get delayed. So write down the question and then ask it to me, and then whenever we'll do that. Okay, so cross-sectional study is an observational design. We study the exposure and disease state at one point in time. So in a cross-section of the population, like for example, if this is time, study is there at only this one point. Why do we do cross-sectional studies? Purpose: to assess burden, characteristics and status of disease in a population at that point in time. Okay, why do we do it? We need to give health services, right? When COVID came, of course it spread so fast. Imagine if it was HIV, it was spreading slowly, right? Oh, do this, do that. Of course, those days we had no treatments for HIV, right? So suppose it's diarrheal outbreak. There was a diarrheal outbreak some time back, right? Orissa somewhere and somewhere else. So we quickly rush resources there. Okay, you identify risk factors to generate hypothesis, and you can compare them in different populations. If you have good enough cross-sectional studies done in other population, you can also examine trends over time. These are called surveillance studies or repeat measure studies. Don't confuse it with a cohort study. You go to the same population over different points in time, but each time you are sampling the population. You're not following up the same patients. Okay, so anyway, so cross-sectional study design is as follows. Okay, friends, so you've seen this part, right? So now you have the study population and you have a group in that population with no disease, and in those people the factor you are interested in is present or absent. Then you also have people with disease. You said prevalence of something you want to find out, right? So you have people with the disease, without the disease. The factor you are interested is again present or not present. Okay, how do you analyze this? We'll look at it later. I'm sure you've seen this in community medicine classes, PSM classes. We did this. They wrote a 2x2 table, isn't it? Yes. Exposure present, absent, outcome present, absent. That's all. Okay, issues. And all of us sitting in this room have attempted or participated in a cross-sectional study, and we usually make a big mistake with this first one of sampling, right? We go and do convenient sampling and then we make all kinds of conclusions on that, which is less than accurate. So, oh, by the way, observational studies are difficult to design and analyze and interpret. RCTs are easier to do. But RCTs are easier to design and analyze and interpret, but doing it is difficult. Logistics and consent and all of that is, okay. So sampling, there are lots of biases. How to analyze that, and we'll briefly look at strengths and weaknesses. Sampling, most important question we need to answer is, did I choose a representative sample? Okay, we always do research on a sample, not on the population. We do you don't have to do the entire population, right? You do, and then is that sample representative of the population to whom I have to interpret this to, extrapolate. There are lots of biases. Non-response bias is a big problem, okay, because the characteristics of non-responders are different from responders. So you need to take a proper sample. Sampling methods. There are two types of sampling methods broadly, okay. One is called probability sampling, the other one is non-probability sampling. Let's go back. Probability sampling is done using a method based on the theory of probability. Do you want to learn theory of probability? No. Let's not do that. Okay. However, we need to choose therefore what is called a random sample, and a good old Excel can give you random samples. Okay, please do that. Okay, yeah, good old Excel on your phone, you can do that. Okay, there's also non-probability sampling, also called convenience sampling, right? And convenience sampling, and most people end up doing this. After this course, dear friends, try very hard not to do probability sampling anymore in your life.
Probability or non-probability?
What did I say? Non-probability. Oh, sorry, did I say other way around? Sorry. Try very hard not to do convenience sampling.
Yes, that's better.
Not to do convenience sampling or non-probability sampling. Okay, just because it's easy, you do that, and the whole thing is a waste after that. Okay, the whole thing is a waste after that. Okay, always probability sampling are preferred over non-probability. Okay, so is this simple, clear, right? Let's go to bias. Okay, in regular life you say, hey, this guy is generally biased, or this lady, always biased here. We keep talking like that, no? So in research also, let's look at what is bias. In research, technically, is giving a disproportionate weight to something. What is the thing? An idea or a thing, whatever. Okay, usually, again, generally close-minded, prejudicial, or it's unfair. So scientifically also is not good. Now biases can be innate or learnt. All these kind of people are like this. We make statements, right? And we sometimes learn it also. Okay, now the next statement is very important in terms of research. In science, bias is a systematic error. Systematic errors are not allowed. Random errors are tolerated. Please write this down. Systematic errors should be avoided. Random errors tolerated or accepted up to a point. 5%. 5% random error chance, I'll allow it. Statistically, we'll allow it. Okay, let's look at bias in health research. Where all can bias occur in health research? At all steps of research, bias can come in. At all steps of research, bias can come in. First, in the conception and design of a study, in the collection, analysis, interpretation of data, in report, publication or review of data, everywhere bias can come in, including during publication, right? Okay. Why are we so worried about bias? Remember, it's a systematic error. We are worried about bias because it leads to conclusions that are systematically different from the truth. You're looking at an apple and constantly calling it an orange. You're systematically wrong. Okay? It's a total waste. Right? So, random errors are manageable up to a particular point. Okay, friends? Okay, and by the way, this is not my definition. This definition comes from this classic textbook, 6th edition, 2014. It's a little old book, but it's the Dictionary of Epidemiology. Okay, number of biases. How many biases did you write? Let me ask. Mani Gupta. Mani or Moni Gupta? How do you pronounce it? M-O-N-E-Y. I pronounce it Mani. Mani Gupta is earning money, not come here. Okay, Moni Gupta. Okay, Anuja Chowdhury. How many biases did you write, Anuja?
I didn't write, sir.
Okay, you didn't write. Very good. Please sit down. Mahavir Singh.
He's not here.
Mahavir Singh is not here. Okay. Dawood Yubi. Yes. How many biases did you write? 5. Very good. 5 biases are there. Do you know all 5? You know some. Okay. Pradeep Maderna. Yes. How many biases? Very good. Okay. How many wrote up 5? Up to 5. 1, 2, 3, 4, 5. How many wrote? You must have your hands up. Up to 5. Okay. How many wrote up to 10? Up to 10. Nobody? How many wrote 2? How many wrote 0? Hopefully there's no 0. Madam wrote 0.
I don't know is what.
Oh no, IDK is not 0. Oh, by the way, 0 is a very important value. IDK is not 0. IDK is not 0. By the way, when you say how many idiots are there in this room? 0. Correct? I am confident about it. Okay? Right? I am very sure that is not IDK. I am very sure 0 is a very important number. Correct? Right? If you are an idiot, you will not be sitting in this room, and if you by mistake if you had come, you would have long back would have ran away. This crazy fellow, I came to learn statistics, he is telling jokes and he is telling we are enjoying life. No, I am a very serious person. They would have gone away. Anyway, sorry. Come back. Okay, so 0 is very important. How many wrote IDK? Okay, I don't know. Okay, that's good. So how many wrote 1? How many wrote 2? How many wrote 3? How many wrote 4? How many wrote 5? How many forgot to bring your hands? Because so many people didn't put your hands up. Okay. So with that little break, which is an important break, I'm telling you a very important concept, which is number of biases. Okay. Dave Sackett is the father of clinical epidemiology. I can go on and on talking about him. He is from Canada. He went to Oxford, blah, blah, blah. Maybe next time I'll give a lecture on evidence-based medicine, about a 20-minute lecture. I'll tell you more about him. So in 1979, hold your breath, he said he listed 35 biases in 1979. In a couple of years, his colleagues added and it became 56. You know today how many biases are there? There's a catalog of biases. You can go and read up about it. You can do a whole symposium on it, not seminar, not 1 hour. You can do a whole symposium on the number of biases. I'll give you the website where the catalog of biases are there. There are about 250 biases. All kinds of exotic biases are there.
So how will you do the study if there are so many biases?
Very good question.
Difficult to do any study.
Don't do any studies, let's have lunch and go home now. There are so many biases. Because just now we said, very good question. Actually, food for thought, not food for the stomach. Food for thought now is, Dr. Anupama, come back soon. Because we just decided workshop was over. Very important point. Okay? Biases can be minimized. Biases can be accounted for. How do you minimize? Listen. How do you minimize and account for it without knowing it? So our first job is to learn. So message number 1, there are lots of biases. And bias is a systematic error. I just told you, it's a systematic error. That means you are clearly telling this is a cup of coffee. You're telling everybody, listen, this is a cup of coffee. You're going on and on. Right? So that means you're being unfair, you're being prejudiced. Okay, so let's go back quickly. Let me keep track of time as well. So biases can be minimized and accounted for. Okay. So here is the 1979 paper. Here, if you want proof of the 1979 paper, Dave Sackett, where he listed out and spoke about biases, Journal of Chronic Disease, right? Dave Sackett's Bias in Analytical Research, that was writing about. Okay, here is your catalog of biases. Go to catalogofbiases.org. This is Oxford University's website, Center for Evidence-Based Medicine, University of Oxford. Look at this, you can select a bias and there are research papers on biases, there are examples, what to do with it. This is a fabulous website. Now you believe me? Okay, there are so many biases. Okay, so what are we talking about? Cross-sectional studies, right? Bias in cross-sectional studies. Recall bias and non-responder bias. These are 2 most important biases. There are many more. So, you need to deal with non-responder bias. Now you know that there is a problem. You know there is a recall issue. So, deal with it. Don't ask a 5-page questionnaire within 10 minutes. Quickly, tell. No, you don't know? Okay, I'll write whatever. That is wrong. So you know there are biases, right? Okay, so let's look at the overview of a cross-sectional design and analysis. So we have the target population and we have the study sample there in the middle, right? Then we gather data from the sample, right? Exposure and outcome, exposure, no outcome, no exposure, outcome, no exposure, no outcome. For this we know already, okay? I've just put it as a little chart over here. How do you analyze cross-sectional studies? All factors are measured simultaneously: exposure, outcome, and confounders. We'll talk about confounders later, not now. Okay, I don't want to confound you with explaining confounders now. Okay, we do that, and we estimate the odds ratio. Write this down. Cross-sectional study, you measure odds ratio, not relative risk. This is a common mistake people make. Okay, in a cross-sectional study, we measure the odds ratio, and this is what we do. We assess the strength of association. It's association in cross-sectional studies, not causation. And we can measure the strength of association by computing the odds ratio along with a p-value or a 95% confidence interval. Okay, we look at the risk factor and the outcome. Okay, we do that in an odds ratio. What are the use of cross-sectional studies? It is suitable for conditions that are relatively frequent. There are lots of cases, right? Long duration of exposure, they are non-fatal chronic conditions. If you do a very bad diarrhea, right, you can only count mortality. You can't count, prevalence as such. Okay, but of course people extrapolate based on that. Not suitable for rare diseases. How long will you wait, right? Highly fatal disease and disease with short duration of expression, and people get the disease and then they die. A very infective cause, right? People die. Okay, let's do some examples and we'll conclude with that. Okay, so this is a study which we did, and the purpose of telling you this, I'm not going to show you the results. The purpose is to tell you the challenges with sampling. Can one of you read this from there? Read it loudly from there. Spectrum study. Read the title, please, somebody. One of you, come. Yes, madam. Yeah, anybody, read loudly.
Situational analysis of the practice patterns in cardiovascular disease management in all regions of India using mixed research methods.
Where is the problem here? Not problem. Where is the challenge here? Sorry, not problem. Where is the challenge here? What makes this unique, novel, and challenging?
All regions.
All regions of India. So I need to know the country. I need to reach the country. I need to sample correctly. You know how long it took us to work out the sampling strategy for us? 6 months and at least 6 to 8 meetings with a statistician. It is not easy. And what do people do? They don't do all this and then they make conclusions. This is what is happening in India. So to answer a question, so the challenge here is all regions of India. This one. Okay, situation analysis, practice patterns, cardiovascular disease, no big deal. All regions of India. Okay, so let's go through this quickly. So the research question: in India, among adults with cardiovascular disease, what are the characteristics, health-seeking behavior, treatments and treatments and outcome? Among physicians, patients, and healthcare providers, what are the barriers to optimal care? What strategies? So this is what we broadly wanted to do, and so. As I told you, the purpose of giving you this example is to teach you from a study that I led how to sample. And it can't be tougher than doing all regions of India. Next one is global. Okay, the next level is global. India is as heterogeneous as you can find. So we did stratified random selection. Okay, secondary and tertiary care hospitals. So cardiovascular disease goes there mainly. Of course, you can also go to primary. That is even more difficult. So our limitation in the study is we didn't go to primary. Okay, so secondary and tertiary care hospitals in all states of India, and within centers we randomly selected physicians who treat cardiovascular disease and stratified by seniority. Whenever people do surveys, it comes to madam's table and then she will tell, okay, all you junior people fill this and base dena jaldi. Okay, fellows creating trouble for me, going on reminding me. That's what we do, right? So we said, no, we don't want only junior people. We want so many professors, so many associate, so many assistant or senior consultants, mid-level consultants and junior consultants, because we went to non-medical college hospitals also. Okay, and it was a country-wide sample. Eventually, we got 124 sites and 1,350 physicians, right? And the sample size was based on the prevalence of cardiovascular disease stratified by the population in the region. Imagine, we listed out all the secondary and tertiary care hospitals, and by region and by prevalence of cardiovascular disease in different states, we sampled, and that's how we got the number 124 sites and 1,300 physicians. Okay, it was stratified by population in the region, and we oversampled the northeast because we wanted to study cardiovascular disease there, but it was not much data were available. Okay, so these were all the sites in the country that we looked at, except Jammu Kashmir. We could not go there at that time. So this is where 124 hospitals, 75 cities in 22 states. Okay, let me show you this example of a study done by some of our friends. This is prevalence of diabetes in 15 states of India. This is the ICMR IND-DIAB studies. IND-DIAB study, it's done quite a bit in Rajasthan as well, right? So let me read out a few things here. So the reason I'm showing you this, let me blank this for now. The reason I'm showing you this is for you to be inspired to do studies like this. Okay, sometimes people will say, oh no, this is all, let other people do it. No, you can, you must, you should do these kind of studies. Okay, so I'm going to read out a few points from here. Community-based sample of 57,000 people from 14 of India's 28 states at that time when they did this. Okay, so okay, let me read out the methodology, right? So this is to tell you how it, okay. T-test to compare continuous variables, chi-square test to assess difference in proportion, and odds ratios were derived from, I will teach you this later on, multiple logistic regression analysis to examine association between exposure and prevalence of diabetes. Okay, this is the methodology used, and these were the results. I'll skip this result. Is there this data freely available in Lancet for you to download? If I had more time, I would explain this. So let me explain what an odds ratio means. Okay, this is rural and this is urban. Odds ratio and 95% confidence interval. What are we looking at? Look at the title of the table. Multiple logistic regression with diabetes as a dependent variable in urban and rural areas. That means now in males, if you are a male in rural area, you have a 1.33 times more chance of getting diabetes compared to females. Or you have a 33% additional risk, and the 95%, can you all see the numbers? The 95% confidence interval does not cross 1. Therefore, this is statistically significant. Since they had such a large sample, you get so many zeros on the p-value. Okay, if you have hypertension, whether you're male or female, young or old, whatever, right, you have a 66% increased chance of getting diabetes compared to somebody who does not have hypertension. Got it, friends? Okay, right. So that's what it means. Let's move on. Overall prevalence, all of this. Okay, let's conclude with patient registry. It's 1:20. Okay, yes. We'll finish that. Anybody going to collapse with hypoglycemia? Collapse after 15 minutes. Okay, so hold on for 10 minutes. Okay, joke about. Okay, what is the patient registry? Okay, I'm going to start with the bottom line first. Bottom line means what I want you to do. I want you to think of and design registries in your institution. Think of and design registries. It's very easy, provided you get few key things right. Okay, so think about it. This is a challenge for you. This is a challenge for you. Okay, so what is patient registry? This is a definition. Organized system that uses different observational methods and there's a specified outcome. So people with psoriasis, I want to collect a particular biomarker and follow them up and look at different treatment, whatever. Okay, we are just giving an example. Okay, the population is, all this is defined, population, condition, exposure. There's a predetermined scientific, clinical or policy purpose. So this is the full definition of a patient registry. Sorry, I didn't put the reference there at the bottom. It's I can't recall this now, but it's not my definition. It's a definition taken from somewhere. Okay, why do we do registries? To describe the natural history, to determine clinical effectiveness, cost effectiveness, healthcare products and services, to monitor safety, measure quality of care. All this you can do. So in other words, it can improve patient management and outcomes in institutions.
So there is something called as cancer registry in the names I know of.
There are many registries going on. In fact, ICMR has been conducting the registry for more than 25 years. Okay, many institutions are conducting registries now. What methods do we use in registries? Registries use observational study designs, but we use multiple study design. Usually it is a cross-sectional study, right, and a cohort or a prospective design is also there. It's not only a cross-sectional study. You can do a cross-sectional study, you can present that, or you can publish it, and you can even follow them up. So it's not only a cohort study, okay. Where do we get data? Community based, population based, hospital based, that's the easiest to do. How do you sample and analyze? There are several sophisticated analytical methods for this, which we can discuss later. It can be single center, it can be a whole region, it can be national, it can be international. There are many international registries ongoing, okay. Let me give you an example of the CREATE registry, and I'm sure your Vice Chancellor knows about this. He's a cardiologist, right? This is probably what he referred to first, Dr. Sandeep. Yeah. Okay, so I was really privileged to run the study. This is background, and I'll tell you, so let's skip all this methodology and all. And here is my favorite diagram. This is the first diagram of the country that I drew and put dots on. So we worked in 89 centers, 50 different cities with 10 regional coordinating centers. So Jaipur was a regional coordinating center, and Dr. Rajiv Gupta, who works in a private hospital, was a regional coordinating center from here. And we had Udaipur as well, we had Bikaner as well in Rajasthan. Okay, so data was collected at admission, and we recruited 20,468 patients from 89 centers and 50 cities in India. This is my first big study, and I'm always very happy about it. And this was published in the Lancet. So every time I see this, I feel happy, right? This was published in 2008. Of course, this is like first girlfriend, first boyfriend, first this, first that, no? Remember those, yeah, those kind of feelings. What is that? There's a nice saying in Hindi. I'm not getting it now. My Hindi is not all that great. Okay, anyway, so here is Dr. Rajiv Gupta. I'm sure you know Dr. Srinath Reddy, the first president of the Public Health Foundation of India. He was head of cardiology at AIIMS. Dr. Prabhakaran also at AIIMS. There are a couple of people here from AIIMS as well. Okay. Yeah, Praful Kerkar, he is a good friend of mine. Right, okay, so let me quickly jump to the editorial that came along with this. So whenever there's a major paper that is published, they ask for an invited editorial, and this was written by Kim Eagle from Michigan Ann Arbor, and these are all guidelines writing people. They write guidelines on how to, okay, so coronary artery. So this is the first statement. This registry is a major milestone since it provides the first comprehensive view of the epidemic of acute coronary syndrome in India and helps to identify opportunities for improvement. Right? Next, a problem well defined is half solved. That was a nice statement, right? So Xavier and colleagues must be commended, blah, blah, blah. And then in 2008 itself, it went viral on the internet. So those days, so BBC wrote about it, the China Post wrote about it, where Manila Times, I mean, there were 3,300 hits within 24 hours on the internet with this. So this is Wall Street Journal, NASDAQ, Wall Street Journal wrote about this. So this is a major, first big publication from India with 20,000 patients. Okay, so as you can see, very dense data. So 20,900 patients, some of them did not have ECG, so 20,468 we analyzed. So let me give you the methodology. We are discussing, apart from showing you my first big paper, before that all chota papers, right? I wanted, okay. Let's skip this methodology and let me come to statistics, right? That's what everybody do. I want you to become comfortable with these terminology. Become friends with statistics, right? You don't have to understand. Do you understand everything about your friends? No, but you become friends with them. You like to spend time with them. So when next time we hear biostatistics, data, p-values, you should feel good and happy, and you don't have to understand everything about it. Actually, a good friend, they say, doesn't try to understand you, just bees with you. Correct? No? Thought of philosophy also for today, just before lunch. This is my hypoglycemia talking. Okay. Okay. Between groups, I'm teaching you statistics now. Between group comparisons of continuous variable independent sample t-test. Categoric variable chi-square test. Okay. Move on. Okay. Mann-Whitney U-test. Cronbach's alpha. Right. Then look at this now. Right. To assess the effects of different treatments, we did multivariable logistic regression analysis to establish whether an association between socioeconomic strata and death could be established. Okay, so here are the results, patient characteristics. I'll skip all of that, but except for this. At that time, only 5% used an ambulance. Now it is about 50 to 60%. That means 40% are still not using an ambulance in India. But 5% to 60% is a massive jump. 3 days later, in the Hindu paper, the health minister at that time made a comment that we need to improve ambulance services. I didn't go and ask him, did you read this and then you said this? That's called a spurious association. It's possible, right? It's possible. But sometimes, the ministers, press secretaries will keep feeding them all this information. Anyway, right? Another one, 75% covered all costs out of their pocket. Huge. No insurance at the time. Now, huge improvement, right? Okay. So here is risk factors, clinical, blah, blah, blah. Well, let's skip all this. And I want to show you 2 more data. Okay, and then we close. Very, very busy slide, but just follow my laser pointer. Okay, we categorize them into rich, upper middle class, lower middle class, and poor. This is not Kuppaswamy's classification. It's something else. Don't ask me now. Okay, first, 53 plus 20. 73% of people who came to the hospital were low middle class and poor. Okay, now when we look at treatment, thrombolysis, antiplatelet, beta blocker, lipid lowering, blah, blah, blah. Okay, just compare between rich and poor. Thrombolytics 61%, 52%. Okay, let's take beta blocker. Let's take lipid lowering 60%, half of that. Okay, ACE inhibitors 63%, 54%. Highly statistically significant because the number in absolute numbers is only 9 or 10, but highly statistically significantly different. Angiogram 40 and 8, 1/5. PCI 15 and 2, 1/7, 7 times difference. CABG 7 and 0.7, 10 times different. What poor people have different types of coronary arteries, is it? So we know the answer. Why they did not get all these treatments. Other than antiplatelet drugs which cost a few paisa, everything highly statistically significant. Mortality by socioeconomic strata, we did multiple logistic regression. Later I will tell you what that means. Okay, first we looked at crude mortality rates. 5%, 5.5 in the rich, 5.9, 6.5, 8.2. When I saw this for the first time, 5 and 8, oh yeah, there is some difference in mortality. Friends, this is where I want you to become friendly with numbers. How do you look at 5 and 8? Very simple. 5 and 8. 8 minus 5 is how much? 3. 3 out of 5 is what percent? 60%. 2.5 out of 5 is 50%. 4 out of 5 is 80%. 3 out of 5 is 60%. Oh, now you are thinking 60% increased mortality in the poor. So this is descriptive. I have just described this. Okay. Okay, and then you do, I have done simple arithmetics, not even statistics, simple arithmetics. Okay, don't worry about this p-value. What is the next question you are asking me? Why? Why? Why is there 60% increased mortality? Oh, poor people, they are smoking more, they are very stressed, they are eating unhealthy food, and all of that stuff. Okay, environment where they are living is all not good, dirty. Oh, correct. So risk factors are different, correct? So what I do is I adjust for all the known risk factors and their differences. That is regression analysis. You take each risk factor, you tease it out, one by one you tease it out. I will show you a formula later on, how you tease it out, one by one. Manually I will show it to you. Okay. So now we remove the effects of risk factors. Here is it. And then for me to understand, sorry, I will blank this now, 1 second. For me to understand the difference, I compute the odds ratio and 95% confidence interval. Alright. This is how non-statisticians should understand statistics. Don't go into all the other things. Okay. So this is now adjusted death rates. This is crude death rate. Adjusted death rate is 5.1, 5.9, 6.7, 7.8. This is now odds ratio. I fix the odds ratio for the rich at 1. Compared to the rich, upper middle class have 16% more mortality, lower middle class 32% more mortality, poor 60% mortality. What is the message? after removing the difference in risk factors between socioeconomic strata, there was no change in mortality. Risk factors therefore did not make a difference to the difference in mortality. I'll say this again. The difference in risk factors did not make a difference to the mortality. There is something else. What else is there?
Time to ambulance, time to reaching the hospital.
Time to ambulance, time to reaching the hospital. Oh, by the way, I'll tell you, no, before that, sorry madam, before that. What are the risk factors we adjusted for? Age, sex, previous MI, diabetes, hypertension, smoking, blood pressure, heart rate, Philip class, BMI, all these risk factors, one by one we adjusted. Did not make a difference. So madam is now telling whether they came, we recorded, I think 6 or 7% came by bullock cart with an MI to hospital. They came by, we recorded. Any other, at that time I didn't write bullock cart in the case report. Any other, they wrote bullock carts. So anyway, so now we adjusted for the following, right? How they came to hospital, which hospital they went, most importantly, the medical and interventional treatments that they took. Okay, look here now. Here is our adjusted, double adjusted mortality. 6.9, 7, 6.5, 6.7. P-value disappeared, and look at the odds ratio. 1, 1, 1, 1. P-value is 1. Simple message. If the poor people got the same treatment as the rich people in hospital, not after going home, in hospital, what proportion of their deaths we can save? 60%. This is research in action. It's an observational study, but that is why it went to the media like that. I had innumerable calls, including from the UK, BBC called, so many people called that whole day. I was in Delhi when the paper was released actually, and we were attending an ICMR meeting, so I was hardly in the boardroom. I was outside taking calls, and then I excused myself. Those days, Dr. Bela Shah, you may remember, she was head of NCD, so she was there attending. So this is research in action. Okay, so let me conclude, friends. Okay. I will not spend time here. This is the stroke registry we did. This is funded by the NIH. I'll run through this, okay. But I'll tell you what value add we did in this, okay. So here it is a 6-month follow-up. That was only 1 month. This is 6-month follow-up. Centers were invited across the country, stratified by region and population. Previous one, we did not do it that way. So our sampling strategy was better here. And can you believe we got data from unconsented patients as well? That was important. We wanted to have a complete idea. Previous one, so in other words, we improved on the study. So here we go. So there is Northeast as well here. This is how we sampled and got, and this was published in the International Journal of Stroke. I led this paper as well, and here are the main results. 1 in 5, 20% were under the age of 50. 20% of those people were less than 50, and a quarter had intracerebral hemorrhage. In Western countries is 10%. Here it is 25%. So bad strokes, and the 6-month follow-up outcomes 25% mortality. So bad risk factors, high mortality, and summary of registries. Organized system, I told you this. Purpose, I told you this. And India needs lot more ongoing studies, and I told you that you need to think of and organize and run registries. And that is the end of session 1 in this course. You have to think, you have to work now. Okay, so what we're going to do is we're going to divide you all into 4 groups and study design. Okay, 1 or 4 study designs for 4 groups are there. Okay, and I'm going to give you a slide template now. I'm going to show you the slide template before we make the groups, because I think few more people are yet to come. And you will sit in 4 corners of this room. One person will sit with a laptop and start preparing the slides, and other people give inputs on what to fill in that slide. Fair enough? Okay, I'm making the job as easy as possible for you. You're getting a template. You just need to fill in, right? And when you go back home, I know most of you live far away. It will be quite late when you go, but make the best of this opportunity, right? So hopefully you have not pre-planned an outing or a party at home today, but don't plan now. If you have pre-planned it, if at all possible, if it does not involve mother-in-law, then you can modify it. It involves mother-in-law, don't modify it, okay? Anyway, jokes apart. So try your best to spend an additional 1 hour this evening or tonight when you get back with your group online. Possible? Possible if you want to make it possible. Okay, so in our courses, when we do the 1 week course, we do something similar. Okay, people hardly sleep 2 to 3 hours a day for a week. It's like, and they are exhausted physically, but they are energized and empowered at the end of it. Energized and empowered. So spend a little bit of time in a group. That means individually also you'll be spending some time on the project tonight. Tomorrow you'll get a little more time to fine tune it, and tomorrow you're going to present it. You're going to present this tomorrow. How long does it take to write a protocol? 6 months. Right, to write a protocol. But we don't want you to make a perfect protocol. We want you to start working together and using a good template, using a map. I'm telling you, follow this path. Okay, so that's what we're going to do. So I'm showing you the slide template now. Okay, so this is my color that I use, yellow, blue and white. My daughters make fun of me. They say this is the IKEA colors, by the way, Sweden flag colors these are, but that's what I like. Okay, so use your own color and font template. Okay, next, write this down or take a picture of this. Your title slide must contain the following. That's the first slide. Your study name, your study design, the date and place, tomorrow 17 January 2024. Give your name, give a name to your group or give your group a name. Okay, and give it an exciting name. In fact, spend a few minutes thinking of that name. And even if you forget the study, you should not forget the name that you gave your own group. Okay, something, whatever you all want to call yourself, something fascinating. Okay, and include all the group members' names. So the apostrophe is here after the S, not before the S. Why is it? This is not English class. Okay, you know. All right. Next, you're proposing a study, right? What is known already? What is the knowledge gap? And what you propose to do? Okay, simple as that. Next, research question. No need to take a picture of this, nothing else here in this slide. So your research question, okay, and you know how to write the research question. Okay. Next, study objectives, one primary objective, only one, don't write 2 primary objectives. By the way, when you write 2 primary objectives, it becomes co-primary objectives and it is a statistical nightmare. And I have seen proposals with 8 primary objectives. Total chaos. So write one clear primary objective. Okay, friends? So for those of you who want technical information, what do you mean by co-primary outcome? You are allotting, it's called alpha spending. Figure out what alpha spending is later. I'm not telling you now. Okay? You got to figure out the alpha spending for the co-primary outcomes, and it is a nightmare, and don't do that. So one clear thing you are getting is have one clear primary objective, 1 or 2 secondary objectives. Don't write 8 secondary objectives for tomorrow at least. Okay. Next, study methods. Okay. Who are your, this is called eligibility criteria. Sometimes people call it inclusion exclusion criteria, means the same, but it's elegant to say eligibility criteria. Study procedures. So this is clinical research. How are you going to recruit the participants? Follow up if applicable. You're going to do a cohort study of 6 month follow up, 1 year follow up, 5 years follow up. Interventions if applicable. Right? That's only in an RCT. Next, how are you going to manage data? We have not discussed data management. We have not discussed statistical analysis. Okay. So write what you can. Write what you can. Okay. Ethical issues, we have not discussed ethics, but go ahead and write what are the ethical issues. All of you have dealt with it. Here is an important point. Ethical issues are different from ethical procedures. Ethical issues, 90% of people, 95% of people say we will apply to ethics committee and we will get full approval before we start. That is not ethical issues. In your study, what are the ethical concerns, right? So you can look up the 4 pillars of ethics and ICMR has written 12 expanded principles of ethics. So it's a beautiful document if you haven't seen it as yet. 2017, very, very nicely produced document, available free for download. If you want a hard copy, it's a nice art paper. It's 500 rupees to buy it. So I would urge departments to buy that copy and keep it. It's really nice, but it's freely available. Okay, so ethical issues, so differentiated from ethical procedures. Okay, approximate budget. You want 1 lakh, 10 lakhs, 1 crore, 10 crores, what is it? Roughly. You don't have to give a detailed budget justification, but if you have 4 or 5 bullet points, approximate budget with about up to 10 bullet points you can write. Or for budgets it's called line items, not bullet points, it's called line items. Serial number, item, multiplicative factor, total, grand total. Okay, serial number, item, multiplicative factor, okay, and total, grand total, final total. That's a nice way to present a one-line budget. Importance of your findings. What are you planning to find? Why is it important? Okay, friends. So this is what we're going to do by tomorrow. Okay, try your best to complete as much as possible, and tomorrow you will get a little more time to be able to do that. Okay, so now what we're going to do is we're going to divide you all into 4. Is there anybody who does not want to be part of the group? You're okay, no madam? You're okay to be part of a group? 100%. Excellent. Okay, so yourself also, right? So very easy. We're going to count 1 to 4. 1, 2, 3, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, you, 3, your number 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3. All right, we are 1% short, which is fine. Okay, so what we'll do is we will now move to 4 corners of this room. Okay, so let us say group, I'll explain it and then we can start moving. You take all your bag and baggage and leave at that time. I'll explain first. So I think group 1 can be on this side. You can start like this and put chairs here and all around like this. So I think roughly about 10 or 12 people I think can manage. So group 1 here, group 2 there, group 3 right in that corner, and group 4 here, right? So if you move to your groups, then we'll allot the study design to you. Okay, let's move to our groups now, please. Listen to me carefully, everybody. Okay, you have 30 minutes from now, 30 minutes, okay, and you should try and complete. Okay, you should listen carefully, please. What you need to complete today is the title slide, need for the study. Now to write this, actually you need to do a literature review. Okay, don't go to that. You can just from what you know or little bit literature review quickly on your phone if you can do. Okay, you can do that, and obviously it will be an area that you are familiar with. Okay, then please write the research question and objectives and at least study methods up to here. Don't worry about going to data management, that we'll worry about later. Study methods as much as possible. This is optional to complete, but before this you complete. Now how do we complete with so many people here? I'll give you a very important principle in group work. Agree to disagree and move on. I'll say this again, agree to disagree and move on. Your job is to not sound very intelligent. Your job is to take the group forward. I'll repeat that again. This is not for you to say how much you know. This is for you to take the group forward. Keep the group in mind, not your personal interest. Okay, so that's very important. Agree to disagree. Otherwise, you will not go beyond the title page. I'll guarantee you that. Agree to disagree, move on. and we can deal with it later. We'll deal with it later. So try to complete as much as possible, and I'll tell you what will happen tomorrow. I told you tonight what you have to do, at least 1 hour on Zoom or Google Meet or something you all have to meet. So first job you'll have to do is get everybody's phone number, make a WhatsApp group. You can do it in 2 minutes. Do that. Google Meet or Zoom or whatever you all are familiar with. Fix a time, probably 8 to 9 p.m. or 9 to 10 p.m. tonight. And another important thing, for homework, that means when you go back, break up your responsibilities. You do literature review, you write this, you finalize this, you look up little more on this. Okay, some of you I'm sure are good in statistics, you can even do sample size. Okay, if possible, go ahead and do all of that. Okay, tomorrow you will get little more time like this, 20 minutes, 30 minutes. And in the afternoon, tomorrow at 3 p.m., you're going to present this for 10 minutes, not 15 minutes. You'll present it for 10 minutes and you will get feedback from the faculty. Okay, and we are planning part 2 of this program. Whenever madam will work it out and let us all know, even I don't know, ideally within a month, not more than 3 months, but in a month to 2 months if you meet again, and if we finalize that, I will tell you in between what to do with your proposal. I'll give you reading material, we will do some online sessions if necessary and if it works out, and then we'll meet again. So we'll work out all that you don't worry. So now what you need to know is, today as much as possible you're going to fill up the slides. Okay, agree to disagree, move on. The team is more important than me, mine, myself. The team, the group has to look good. Okay, me, mine, myself we can do later. Okay friends, okay, tomorrow, very important, your name will be picked up from this ball to present. So don't designate, I will write notes, I will do this and you present tomorrow. That is not going to happen. And because of that, don't escape tomorrow. Okay, come and do your best to present. Okay, so here we are not, this is not the final one. So you will learn how to work in a group, and that's really, really important. Okay, any doubts now?
So, since they are of diverse background, so when we are selecting the topic, you are going to give us the design or whatever.
We'll give you the design, but the topic you will choose. Yes. From alopecia to tinea pedis, anything you can do. Okay, head to toe, you do whatever you want. Okay, but the design will be chosen now. Okay, clear? Group 1, can you come and pick your design? Come, one of you pick your design and read it out. Yeah, from there itself. I'll come to you. Yeah. Read out the design. Open it.
The design is to be cohort.
Okay, your design is cohort study, group 2.
Cross-sectional.
Okay, cross-sectional or
registry.
Okay, group 2 is doing cross-sectional or registry. This is group 3.
Case control study.
Okay, yours is?
Case control.
Case control study. So what is left over? What is left over? You have no choice. RCT.
Randomized control trial.
RCT, randomized control trial.
Okay, you have 30 minutes. Please get started.
PRV, which is steroid.
in subelectrolyte P.
PRP के हमारा प्लाज्मा था, प्लाज्मा फ्रैक्शन है।
इसके साथ जो न्यू इंटरवेंशन है उसको कंपेयर करते हैं। आरसीटी फेज 3 ट्रायल है जो फार्मेसी फेज 3 ट्रायल है आरसीटी ड्रग्स ही होता है उसके सेफ्टी एफिकेसी होता
सेफ्टी एंड एफिकेसी को करेंगे कैसे? क्वालिटी ऑफ लाइफ TRP versus अच्छा, okay, that's a good one. Post acne scars में acne scars हो गया versus CO2 laser और effect क्या दिखेगी कि वो
effect उसमें scoring system होगा, उसकी grading से
What type of acne are you taking like that?
You are from dermatology?
You can remain in your groups. Stop your discussions, please. Remain in your groups itself, but turn around this side. Those of you with your backs towards me, just turn around. Remain in your place itself. Just turn around. And maybe we are all the IT person because 3:55 because 4 o'clock is the bus. Okay, so we have 35 minutes exactly. So therefore, in the next 1 hour
statistics, and I want to also tell you what we will do in part 2 for you to have an idea and not to worry that so many things we did not cover. So what shall we do first? Case control, biostatistics, or you want to do, because your group is case control, is it? Okay, other than you people, you're so
the biggest group. It looks no.
Yeah, no. This group has done some major hanky-panky work here. Okay. No. Okay, other than that group will not decide now. So do you want to do case control designs, biostatistics, or research management, which we will be doing part 2 later on?
Biostatistics.
You want to do overview of biostatistics? Biostats. You are not eligible to vote. Okay, but this one has to disappear. It is going to block about 30% of our biostatistics.
IT वाले को किसी को बुलाओ, कौन है यहाँ पे? तुम बोलो जरा IT वाले को फोन करो. अनुराग कहाँ पे कर दोगे?
Okay, maybe if I put it on full screen, does it disappear? No. What is the sign in and all that? Okay, while this is being sorted out, you need to see that. Okay, while this is being sorted out, reminder again. So I heard this group deciding what time to meet tonight. So at least 1 hour, all of you should participate. Please don't let it to other people to do. They will do a good job, they will learn and go, you will miss out. So take extraordinary efforts to participate tonight. Okay, and also, each of you will have to contribute to the group as well. Okay, I will check this up, I will do this. So feel free to read anything, anywhere, ask anybody for help other than me. Okay, other than me, ask anybody for help and go ahead and do your best. Moments. Aha means, wow, I never thought of this before. 3 aha moments for you. If you can't find an aha moment, the most important learning for you today. Okay, whether you saw it on the screen, you heard from your colleagues, you heard from me, 3 learnings for you today or aha moments. Wow, I didn't know this. Okay, please go ahead. 3, minimum 3, write 5, 8, 10. Let's not waste time with that. Let's use our minds in a productive way. Please go ahead. I think this one, next one, click that. I'm going to give you, as I told you, a flavor of biostatistics. Try to make this as simple as possible. When we do part 2, each of these topics will be one whole lecture. Okay? So you're just going to get a flavor of what and what is going to come, but it will be somewhat useful for you as we discuss when we're going along. Okay. Where is that remote? Oh yeah, I'll take it. First, we're going to do an introduction to biostatistics and parametric tests. So in that, we're going to look at types of data, descriptive statistics, inferential statistics. What is the meaning? How to present data, what is dispersion, tests of normality, and data transformation. All these are important for doctors or for non-statisticians, let's put all researchers. Okay, and concepts over here. In parametric tests, we'll do t-tests, at least unpaired and paired t-test. Oh yeah, I think you all have to come this side. Come. Okay. Then we'll do ANOVA. What is the meaning of one-way, repeat measure, factorial, MANOVA and ANCOVA? I'll be giving you just concepts. So this is introduction to statistics and parametric tests. Okay. Next, we go to non-parametric tests. I'm sure all of you are familiar with chi-squared tests. That's the correct way to write it, not chi-square test or, so there are multiple tests, chi-squared tests. Okay, then we'll also look at Yates correction, Fisher's exact test and McNemar's tests. So these are all the chi-squared tests. Oh, one more is there, Mantel-Hansel. There are 3 or 4 more chi-square tests, but these are the commonest ones that we need to know. The other non-parametric tests are Kruskal-Wallis, Mann-Whitney-U test. Then the next chapter we'll do is correlation and regression. What is correlation? Firstly, we get confused between dependent and independent variables, no? Which is dependent, which is independent, which to put where. So I will clarify that for you. And then we look at types of correlation, Spearman's correlation and Pearson's correlation. These are 2 commonest ones. We look at correlation coefficient, how to do the hypothesis testing and look at confidence interval. After correlation, we'll move to regression. Why regression? What is the meaning of slope of a line? Where do we get that? What is simple regression and multiple regression? Under multiple regression, we have linear for continuous variables and logistic regression for dichotomous variables. Then we will look at survival analysis. Right? Today, if you're prescribing drugs, invariably they have analyzed it using survival analysis, and therefore we need to know that. We need to learn how to interpret a Kaplan-Meier curve, what's a Cox proportional hazards model, what to make of it. Concepts alone. I mean, some of the notations and equations are there, but we will skip over that and we will do. Okay. So we will firstly look at how to summarize. Firstly, what is survival data? Why do we need survival data? Right? Why can't we just manage with relative risks and absolute risks and number needed to treat, etc. So we will look at why we need survival data, then how to summarize them. Mean survival, survival rate and person years. I'm sure all of you are familiar with person years. Then we look at the life table approach, the actuarial approach and the Kaplan-Meier approach. And why in medicine we use Kaplan-Meier and not the actuarial approach, we look at that. So we have 2 or more groups. How do we compare 2 or more groups? We look at the log rank test. And then we have to adjust for covariates. Adjusting for covariates we do with the commonest one. There are many ways. The commonest one is the Cox proportional hazards model or Cox PH model, Cox proportional hazards model. And finally, the hazard ratio and how to interpret a hazard ratio and its 95% confidence interval. So this is what survival analysis is about. All right. So this is a quick overview of what we will be doing. Now, let me at least do the introduction to statistics for you, the basics. Okay. So we have learnt about descriptive statistics and inferential statistics. Descriptive statistics, when we present and organize and summarize the data we have. We need to do descriptive statistics. We need to know our sample. We need to know what we have collected, and then we infer. Infer means making a conclusion. We have compared 2 or more groups and we had a hypothesis. We are answering that question now. So inferential statistics allows us to generalize from the sample data to the population data. What does this mean? Let's look at it. I gave you text. Let's look at a cartoon or an image, right? We have the population, right? Population could be people of India, people of Rajasthan, or Jaipur city, or Jaipur urban, Jaipur rural, whatever. That is your population. You never study a population. There's no need to study a population. And you don't have to study 1.4 billion people to make a conclusion about India. You need to sample that properly, right? So we take a sample from there and we make a hypothesis, or maybe first make a hypothesis and then take a sample, okay? Then we take the sample and we study the sample, right? We study the sample and we make conclusions based on that sample, right? Test group, comparator group, right? Cases, controls, cohort with exposure, without exposure, with outcome, without outcome, all of that we see. We make conclusions based on the sample, then we subject it to inferential statistics, then we generalize it to the population. Therefore, this applies to the state of Rajasthan. Okay? So, this is in simple terms an overview of what we do with statistics. So, I didn't give you any formula, no equations, nothing here, but this is what it means. Let's look at a few definitions. We kind of get confused with these things. Definitions. What is a variable? Okay? Variable is something that varies, as simple as that. Your blood pressure is different from your neighbor's blood pressure. Your height is different from her height, right? Anything that varies is called a variable. What is data then? Simple, okay? So, quantities, as I was telling you, quantities which vary from individual to individual. What is a parameter?
That is the measured item of the variable.
Simple. You've collected the variable, okay? Don't worry about the theoretical model, okay? Now, parameter is what you get out of that. You don't take, suppose I measure blood pressure of all these people. What do I use out of it? I use a parameter. So, variable, this is what, so blood pressure is a variable. That number you get, 132, no, the number you get, 132/84 is the data you collected. Then in this group, I need a parameter which is in a normal distribution, suppose I'll tell you about normal distribution shortly, it is mean and standard deviation is called the parameter. Okay, so now you got the difference between variable, data and parameter. In a screening test, maybe it is sensitivity and specificity, or in a graph, maybe slope of a graph. Data is the number that you recorded, 1.43 meters, 22.3 BMI, okay, that. Alright friends, so one other thing, have you ever heard the word datum? No, only few people. So madam, tell us what is datum.
So data is plural. Data is never singular.
Correct.
Datum is the singular part.
Right. We invariably never use the word datum because what do we do with singulars? So therefore, the word data is plural. Okay, little bit of English here. It's nice to write it correctly because you send it to Lancet, they'll correct that. Okay, right. So the word data is plural, and to the best of my knowledge, this is the only sentence in which you say is after data. Otherwise, you always say data are normally distributed, data were collected, data have been, not data has. Data have been managed using this software. Got it? So the word data is plural. Data is plural. Everywhere else you use where, have. Okay, that is thoda sa English. Okay, let's move on. Types of data. This is all theoretical. I'm going to skip through this. Categorical, nominal, ordinal, and this is very easy to get confused here. So I will leave it to you to read, and I'm sure all of you can figure that out. Okay. So this is summary. Now normal distribution. You've seen all of this. We will go through this in detail. Okay. Let me skip all of this. Just to keep in mind that almost all data, 99.7% of data in a normal distribution falls within 3 standard deviations. right? Then we look at what is normal and skewed distribution, negatively, normal, positively skewed, etc. But all that is fine. What is it that you need to know? When you get your data, it is very important for you to know whether it is normally distributed or not. It's a big deal. It's not a small deal. It's a big deal. Okay. So therefore, you need to test for normality. So when you go to a statistician, first thing you can ask, here are my data. Here are my data. Okay. Here is the data set. Okay. Here is the data set. Here are my data. Give it, and could you please check for normality? And what test are you going to use? So you can sound very intelligent now. So testing for normal distribution is a prerequisite for statistical tests. Sometimes the statistician will just do it and then make a note in the side somewhere and carry on. Why to bother the doctors with all this, they will say. No, but now you can ask them. So firstly, you can visually look at your data. Okay, you can make plots and graphs. You can do it yourself. Okay, you can also do statistical tests. For the plots, okay, it's a graph. It's called a QQ plot or a quantile plot. You will see this in the statistical section of journals. Okay, quantile plot, right? Okay, so the statistical test for normality, there are two common ones. There are many. There are two common ones. One is a little bit of a mouth or a tongue twister. This is the Kolmogorov-Smirnov test. Kolmogorov-Smirnov test, and we also have the Shapiro-Wilks test. Shapiro-Wilks test. And Shapiro-Wilks test is more appropriate for sample sizes up to about 2000, right? And anyway, so this is what you will get. You get a p-value and then you get it. Okay, now data transformation. Data transformation is not data manipulation. What is the difference between altering data and transforming data? Altering data is the raw data, you change it and use it as such. When you transform data, hopefully it's there in my slides, but in case it's not there, it's coming to my mind, I will tell you. Dr. Anupama, remind me at 50, 55, whatever I'm doing, I'll stop. 50 you remind me, so I have 5 minutes to wind up. Okay, I'm keeping track of my clock as well. So where was I? Okay, so you transform the data, you do the statistical tests. Remember anti-log in high school? Log, anti-log? Something similar we do. Okay, so after you do the analysis, you back transform the data. Okay, so why you need data transformation? One is for improved appearance in graphs. Pharmacology people or microbiology semi-log paper, you seen that? Yeah, that's one of the reasons. Okay, now you do data transformation to change the distribution to meet statistical assumptions for all the tests. Okay, and also for easier interpretation. So what is data transformation? I told you briefly. You apply a mathematical function to each data point. Okay, each data point, let's say Zi, for example, just taking some notations, Zi is replaced by a transform value. So every one, an f function is applied to each value. Okay, this is easy to understand, right? Y1, okay, right. Okay, next, I want you to think of something in your approach to statistical analysis. Think over something. Now, you want to get from here to your home in Jaipur. All right. You want to get from point A to point B. And one of the best ways to go is a nice fancy car. Okay. Right. So, would you want to know everything about the car before driving it? Give me the BHP. BHP is what? Brake horsepower. What is the horsepower of the car? What is the torque? What is the cylinder configuration? What is the curb weight? What is the wheelbase? And do you want to know all of that? What do you need to know?
That works.
It works. New car. How do I open the car? First, how do I open the car? Okay. How do I open the car? So you need to just drive the car. For all that, you don't need all these details. Open the car, sit down inside, make sure there is enough petrol, there is whatever. How to start it, how to engage it, and move. Oh, very important. Where to stop? How to stop? Brakes. Okay. So you drive. You know what is even better? Be driven in the car. Sit at the back. Chalo driver. You can do that. What would you prefer to do with statistics of the three options? 1, 2 or 3. How many people for 1? Hands up please. I want to know everything in statistics before I start doing research. Okay, nobody for 1. Everybody brought your hands back after lunch, isn't it? Or left it in camp? Hands are here. Let's have a demonstration to see if your hands are here. Ah, wonderful. Okay, okay. Option 1. You want to know everything about the car before driving? Nobody. You want to drive the car yourself?
Yes.
Very good. How many want to be driven in the car? Hey, rest of you should put your hands up. Now something is not working in this group. If you add the first 3, A, B and C, it should be the total number. It's not working. So you people are tired today. Should we stop? Will you cooperate with me about putting hands up? How many for option 1? Hands up? Nobody. How many for option 2? You want to drive and go. Okay, so this is about 20 people. Okay, how many want to be driven in a car? Sit at the back and go. Not all of them. Many of them haven't put their hand up. For what did you put your hand up? What did you put your hand up? 1, 2 or 3? You want to drive the car. I was just joking. Okay. So, you know what I would prefer? I would prefer to drive the car. I'll give you my preference. It's up to you. Okay. I prefer to drive the car so that I have some control and I'm a little bit more empowered. Occasionally I'll sit at the back. That's what I do in my life. Wherever possible I drive. Route is not good, too much traffic, whatever. Evenings when I go out in Bangalore, I get a driver and then we go. Okay. So I prefer that. And I would urge you people to know driving and occasionally drive. If you're sitting in the back seat, if there is some issue with the car, driver doesn't show up or some emergency you have to go, it's better to know driving. So what we are doing now is to teach you little bit of driving, okay? Definitely not option 3, definitely not, occasionally you can be option 3, definitely not option 1. I'm not showing you formula and all the notations, and okay? So I've told you about this, so let's move on, 1 second. Okay, so wait a second, let me skip a few things, and presenting data you people know, so I'm not going to bother you with that. Dispersion also you know, but let me tell you.
There are no slides there.
Don't worry.
He's put B there. So he put B on it? He's put B and he's working on it.
Okay.
Even
Okay.
I noted that.
Okay, measures of dispersion. Okay, so measures of dispersion is how closely do data cluster around or how spread out they are. It's also called a measure of central tendency, right? Right? And getting to know that gives you an idea about the data that you have. What are the common measures that we know? One is range, then interquartile range, variance, and commonest what we use? That's not dispersion, that is central tendency. Is standard deviation. Okay, mean and standard deviation. Okay, then we use median and interquartile range. Variance is there. What is range?
Range is full range. Minimum to maximum.
Okay, another common mistake we make. We learned this in school and we continue with the same thing. Okay, lowest to highest we take range. No, I learned this in McMaster in 2005. It is one number. Yeah, I am sure it is surprising to people who know statistics a little bit. Okay, all right. So I'll tell you more about that and why we will discuss more. Okay, when to use what? Nominal kind of data we use mode. Ordinal data we use median and mode. And measure of dispersion we use range and IQR. Right? Interval data we use mean, median and mode. We use standard deviation, range and interquartile range. And finally for ratio data we use mean, median, mode, standard deviation, range and interquartile range. Okay, coming to a very important slide. At the end of it you take a picture of this one. Okay, parametric versus non-parametric tests. Okay, firstly let's understand parametric data and non-parametric data. We look at it as what are the distribution, what are the variance, what are the typical type of data, etc. Right? Then how to choose the test, which correlation test. If it is an independent measure of two groups, independent measure of more than two groups, repeated measure of two conditions, repeated measure of more than two conditions. So one by one let's look at it. Parametric test, distribution is normal. Definition of normal distribution, how to test it, we briefly discussed, right? Typical data, ratio or interval, and central measure is mean. Okay, an advantage is you can draw conclusions. A common mistake we make is we take continuous data and we categorize it. Never do that. Please write it down. I may forget. Never categorize continuous data. What do we mean by that? Blood pressure is continuous data. Okay? Control or bunch it up into high, medium, low and then compare that. Wrong. Okay? Don't categorize continuous data. You lose power. Don't categorize continuous data. See, this is what I want to share with you. This is what I want to share with you, where we make mistakes and how to avoid that. Non-parametric data can be any distribution. Ordinal or nominal data usually go to non-parametric, and we usually use median for central measures. Okay, and it is less affected by outliers. That's an advantage. Okay, now names of statistical tests. Sure.
That you talked about converting continuous data into categories. What about tests that use where you can use categorical data and convert it to continuous?
Now, if it is already categoric, unless you have the raw data.
So sometimes, let's say, I'll give you an example in gastroenterology.
Yeah.
We have the child score.
Yeah. Child book score.
Score is a score.
Yeah.
Okay, 1 to 15, which is categorized as child A, child B, child C. And sometimes people tend to kind of, which is score 5 is the minimum.
Right.
So score 5 and score 10 is not necessarily double. So it is not
Very good.
continuous data.
It is not continuous data.
But people use it.
Wrong. In my opinion, it is wrong.
Yeah. So because it is not actually continuous.
It's not continuous. It is not continuous data. So based on those numbers, you've categorized them into mild, moderate, severe, whatever, and use it accordingly. Use it accordingly. Yeah. Okay. Right. So let's look at the commonest test. Commonest, not all the tests, commonest tests. Okay. For correlation, it is Pearson's correlation. And independent measures with two groups, independent measures t-test, or just say t-test, or say students t-test. All of that means the same. Independent measures more than two groups, simply say ANOVA is fine, or the full name is one-way independent measures ANOVA. That's, if you just say ANOVA, it's fine, people understand it. When we have two conditions, matched pair t-test. So I'll just pause here for a moment. When we do the full lecture, we start with data that you have seen. Blood pressure, height, hemoglobin, what kind of data, rather than giving you theory, what kind of, how shall we analyze, what was it done? Okay, there was something done, then there was a treatment given, then we measured something else. What analysis? Then you'll see, oh, it is matched. Okay, let's use the matched data analysis, matched pair t-test, okay, or before after test. Then we have the one-way repeated measures ANOVA, right, for more than two conditions. Then for non-parametric, the correlation test is Spearman's. For independent sample t-test, it is Mann-Whitney U test. Then we have the Kruskal-Wallis test for more than two groups, the Wilcoxon's signed rank test, that is the full name, for two conditions, repeated measures, and then the Friedman's test for more than two conditions. So these are the common ones we'll be doing. I'll just give you a flavor of the t-test and then we will close. Okay. T-test, we have the one sample t-test and here the two sample t-test, and we commonly do the two sample t-test, right, with independent samples or dependent samples. That is the unpaired t-test or the paired t-test. Independent samples, it is unpaired t-test, and dependent samples, dependent means the same sample before and after. Okay, that's a paired t-test. Okay. Now let us understand the t-test. What is behind the scenes without going too much into formula. Okay. Now, when there is one group here and another group here, there is signal coming from one group, right? This is the true measure, but there is, every data will have variations and things that we don't want. We'll call that noise, correct? I'll give you, when we give examples, tell you, okay? So the t-test is a ratio of the signal to noise. I'll use a laser pointer here, is the ratio of the signal to noise. So there are two means, group A mean, group B mean. The difference between the group means is the signal, but there is also variability between the groups, correct? So we need to account for the variability. So look at this graph here now. Let's say this is blood pressure of one group is here like this, another group is here like this. Now this is the numerator. The mean difference between the two groups is the numerator. Now you have variations here, and can you see this? What is happening? There's a bit of overlap here. That is the noise. That means this person's number and that person's number is the same. So why is the same thing although they had different interventions? Are you with me? I know we are end of the day. Are you with me on this? Figured out what is signal and noise? That's all, friends. X bar is mean of 1. X bars, this is test and control. This minus this, and the standard error of the same thing is the denominator. Finished. This is our concept. So at the end of it, you as a medical person, non-statistician, all you need to know is difference between signal and noise, right? That's it. Okay, numerator, this is what I told you, and if you want to know how to calculate the standard error for this is the formula, if you want to be bothered by that. Very importantly, if you go to SPSS, okay, so actual numbers that are done. So we did a small little test, 15 sample year, mean of 8, mean of 14, standard deviation, standard error of the mean. Okay, then we do the t distribution, we look at the degrees of freedom, all that I'll explain to you, and the 95% confidence interval. Okay, so that gives you a flavor of what I tried to show you for the t test, and similarly we'll be doing the other tests as well. Can you still, oh, you can't see that, is it, when I close this? Oh, okay. Anyway, so the rest of what I wanted to show you is how to do the paired t test, the date. So I showed you about 20%, time for you all to leave, yeah, 20 or no, 1 or 2 minutes I'm concluded, okay, 55 exactly. If you want to leave, you can leave. No, 1 or 2 minutes we'll finish, exactly at 55 in my clock. Okay, so like this. So what I showed you for t-test is about 25% or even less than that of how we will go about the t-test. Okay, tomorrow morning we will do case control designs, randomized control trials, and cohort. We'll do that. We'll get little time just before lunch or just after lunch for you to put your slides together. We'll present, and then we'll plan or remind me to tell you what will come in part 2. Research management. I will show you just that one slide in research management. Oh, I think I showed you. Did I show you?
You said we will be next time.
Oh no, I think this is research management. This is research management, what we'll be doing. Sample size, data acquisition, database, regulatory issues, ethics, evidence-based medicine, grant writing, presentation and publication. Okay, thank you very much. Goodbye and good luck.